Hello, NCLEX aspirants. Welcome to our first NCLEX practice test series. Here's the exciting part. The student who provides the correct answers to all 150 questions in the comment box will be selected as the winner. The winner will receive $1,000 or free enrollment to our NCLEX Review online course. Every month, we randomly pick the winner, so make sure to answer all 150 questions. After submitting your answers in the comment box, confirm your entry in the contest by reaching out to us via WhatsApp or email provided on our website. Visit the link in the description for contact info. Our team will only contact you using the authorized number available on our website, so be cautious of fraudsters. Check the Community tab for winner announcements. You can read all the rules of this contest in the description box. This video contains a full-length practice test with 150 questions. Imagine you're sitting for the actual exam and answer each question in the comment box. Afterwards, match all correct answers to gauge your preparedness for the NCLEX exam. See how many questions you got right out of 150. We always take feedback from our students who pass the exam to understand which questions were asked. After gathering feedback from 5,000 students who passed the NCLEX exam in the last 5 years, we've compiled these 4,500 frequently asked questions. These are the board's favorite picks. Are you ready to ace the NCLEX on your first try? Use our 30-33 strategy. In 30 days, watch 30 practice test videos. Watch each video 3 times. By following this method, you'll master 4,500 NCLEX practice questions and boost your chances of passing NCLEX on your first attempt. Stick to the 30-33 rule and achieve your NCLEX success. You can also enroll in our online course to pass NCLEX with confidence. We are offering a 70% discount for this month only, and seats are extremely limited. Don't miss out on this incredible opportunity to secure your success before prices rise. The link is given in the description box. And don't forget to hit that subscribe button. This is just the first practice test video in our series, and we've got 30 more amazing practice test videos coming your way. Do you want to know the SATA questions and the latest questions asked in 2023 and 2024? Stick with us till the very end of the video. We've added the SATA questions in the midsection and the recently asked questions in the last portion of the video. All right, let's dive in and start the video.
All right. Here we go! This question has popped up in the NCLEX exam 4 times over the past 5 years. It's super important, so listen up. Remember, these questions are memory-based, so the slight content can be different, but the main information is the same. The nurse is caring for a patient with a suspected bowel perforation. Which of the following actions should be avoided? A. Conducting a CT scan of the abdomen. B. Performing an exploratory abdominal surgery. C. Using a water-soluble contrast agent like gastrographin for a GI X-ray. D. Giving a laxative such as milk of magnesia after a GI study. Take a moment, pause, think about your answer, and type it in the comment box below. Remember, commenting on all 150 questions gives you a chance to win $1,000 or a free enrollment in our online NCLEX review course. Ready?
Stancoast.
Let's reveal the answer.
Coaching.
The correct answer is D. Giving a laxative such as milk of magnesia after a GI study. Here's why. Option A, conducting a CT scan of the abdomen, is incorrect because conducting a CT scan of the abdomen is not contraindicated in patients with suspected bowel perforation. In fact, a CT scan is often more beneficial than a standard X-ray for identifying the location and extent of a bowel perforation. CT imaging provides detailed cross-sectional images of the abdominal organs, allowing for better visualization of any perforations, abscesses, or other complications. Option B, performing an exploratory abdominal surgery, is incorrect because performing an exploratory abdominal surgery, laparotomy, is often necessary to diagnose and treat bowel perforation. This procedure allows direct visualization of the abdominal cavity and the identification and repair of the perforation. Option C, using a water-soluble contrast agent like gastrographin for a GI X-ray, is incorrect because water-soluble contrast agents, such as gastrographene, are indicated for use in patients with suspected bowel perforation who require a GI X-ray. Option D, giving a laxative such as milk of magnesia after a GI study, is correct because administering a laxative like milk of magnesia is contraindicated in patients with bowel perforation. Great job! Now, let's move on to the next question. This next ethical responsibilities question is crucial and has been asked in the NCLEX exam 6 times in the last 5 years. Are you ready? A nurse is conducting a workshop for new nursing students about the ethical responsibilities of their profession. One of the students correctly states that the nurse ensures that the rights of individual patients and patient groups are upheld and protected. This role is best described as A. Autonomy, B. Utilitarian ethical practice, C. Advocacy, D. Deontological ethical practice. Take a moment, pause, think about your answer, and type it in the comment box below. Remember, commenting on all questions is essential because it helps you evaluate your preparedness by matching your answers with the correct ones at the end. Ready? Let's see if you got it right. The correct answer is C, advocacy. Here's the rationale. Option A, autonomy, is incorrect because autonomy refers to an individual's right to make independent, informed decisions without coercion. While autonomy is an important ethical principle in healthcare, it specifically pertains to the patient's right to self-determination and informed consent. It does not encompass the nurse's role in actively upholding and protecting the rights of patients. Option B, utilitarian ethical practice, is incorrect because utilitarian ethics focuses on the consequences of actions, aiming to achieve the greatest good for the greatest number of people. It does not specifically address the rights of individual patients and patient groups, but emphasizes the overall outcomes and benefits of actions. Option C, advocacy, is correct because advocacy best describes the nurse's role in actively upholding and protecting the rights of individual patients and patient groups. Advocacy involves speaking up for patients, ensuring their needs and wishes are respected, and protecting their rights to receive appropriate and ethical care. Nurses act as advocates by supporting patients in making informed decisions, protecting their rights, and promoting their well-being within the healthcare system. Option D, deontological ethical practice, is incorrect because deontological ethics emphasizes the importance of rules, duties, and obligations in moral decision-making. It does not specifically relate to the nurse's role in upholding and protecting the rights of individual patients and patient groups. All right, fantastic.
NCLEX
Let's move on to the next question. This next medication administration question has appeared 3 times in the NCLEX exam over the last 5 years. Are you ready? A nurse is caring for a patient with chronic kidney disease who is experiencing low calcium levels, hypocalcemia. The nurse is administering phosphate-lowering medications. Why is this treatment being given? A. For calcium levels to rise, phosphorus must be below 5 milligrams per deciliter. B. Lowering serum. Phosphorus leads to an increase in serum calcium. C. Calcium regulation is primarily achieved by reducing phosphorus levels. D. When phosphorus is excreted, calcium is also removed from the body. Think you know the answer? Type it in the comment box. Don't forget, every comment you make gets you closer to evaluating your performance at the end. All right, let's check the answer. The correct answer is B. Lowering serum phosphorus leads to an increase in serum calcium. Here's why. Option A, for calcium levels to rise, phosphorus must be below 5 milligrams per deciliter, is incorrect because there's no specific phosphorus level that automatically makes calcium levels go up. Many factors, like kidney function and hormones, affect the relationship between calcium and phosphorus. Option B, lowering serum phosphorus leads to an increase in serum calcium, is correct because phosphorus and calcium have an opposite relationship. When phosphorus levels decrease, calcium levels in the blood increase. This helps raise calcium levels, which is important for
Stancoast
patients with
NCLEX coaching.
low calcium.
Stancoast
Option
NCLEX
C,
coaching.
calcium regulation is primarily achieved by reducing phosphorus levels, is incorrect because calcium levels are controlled by many factors, such as hormones and vitamin D. Reducing phosphorus helps, but it's not the main way the body controls calcium levels. Option D, when phosphorus is excreted, calcium is also removed from the body, is incorrect because even though phosphorus and calcium levels affect each other, removing phosphorus does not directly remove calcium. Lowering phosphorus actually helps the body increase calcium levels. Want to take your prep to the next level? Enroll in our comprehensive NCLEX review course. You'll get access to 10,000 questions from the past 5 years, 10 mock tests, 50 hours of animated content, 1,000 hours of recorded lectures, daily 1-hour live classes at 9:00 p.m. Eastern Standard Time, and an exclusive NCLEX Prep ebook. And guess what? Enroll now and save 70%. This offer is for a limited time only, and seats are also limited. The link is in the description. Grab your spot now. Pause the video and check out this comparison chart to see why our NCLEX review course is the best compared to other course providers. Make an informed decision and choose the best. Now let's move on to the next question. This next patient positioning question has been featured 5 times in the NCLEX exam in the past 5 years. Pay close attention. It's a critical one. For a client on bed rest after a spinal cord injury, how should the nurse position the client's feet to prevent foot drop? A. Hyperextension. B. Abduction. C. Supination. D. Dorsiflexion. Share your answer in the comment box. Remember, your comments are essential as they help you gauge your readiness for the exam. Let's reveal the answer. The correct answer is D. Dorsiflexion. Here's the rationale. Option A, hyperextension, is incorrect because hyperextension refers to the excessive extension of a joint beyond its normal range of motion. This position is not suitable for the ankle joint and can potentially cause injury rather than prevent foot drop. The goal in preventing foot drop is to maintain a neutral ankle position, which hyperextension does not achieve. Option B, abduction, is incorrect because abduction describes the movement of a limb away from the central axis of the body, which applies more to the hips or shoulders than to the feet. This movement does not address the positioning of the foot to prevent foot drop. The prevention of foot drop specifically involves managing the angle of the ankle, not the lateral movement of the limb. Option C, supination, is incorrect because supination is the rotation of the foot, so that the sole faces inward. This position does not provide the necessary support to the ankle joint to prevent foot drop. Foot drop is a condition where the foot cannot be lifted at the ankle, causing the toes to drag on the ground while walking. Proper positioning to avoid foot drop involves maintaining the foot in a more functional alignment. Option D, dorsiflexion, is correct because dorsiflexion keeps the foot at a right angle to the leg, preventing it from falling into a plantar flexed position, where the toes point downward. This upward flexed position helps maintain the ankle joint in a neutral and functional alignment, thus preventing the shortening and tightening of the Achilles tendon and the muscles on the back of the leg. Maintaining this position is crucial for clients on prolonged bed rest to preserve the range of motion and prevent contractures, which can lead to foot drop. By keeping the foot in dorsiflexion, the nurse helps prevent the development of a dragging gait and other mobility issues associated with foot drop. Now, let's move on to the next question. This next seizure-type question has appeared in the NCLEX exam 7 times in the past 5 years. Ready to tackle this? A patient with epilepsy suddenly experiences a brief episode of muscle weakness and collapses to the ground while under the nurse's observation. What type of seizure is this? A. Tonic-clonic seizure. B. Focal impaired awareness seizure. C. Absence seizure. D. Atonic seizure. All right, pause, think, and comment your answer below. Let's see how prepared you are. The correct answer is D. Atonic seizure. Here's why. Option A, tonic-clonic seizure, is incorrect because tonic-clonic seizures have two phases. First, the body stiffens, then there is jerking of the muscles. These seizures last longer than atonic seizures and are more intense. The brief muscle weakness and sudden collapse seen in the patient do not match a tonic-clonic seizure. Option B, focal impaired awareness seizure, is incorrect because focal impaired awareness seizures involve changes in consciousness and repetitive movements, like lip smacking or hand wringing. These seizures do not cause sudden muscle weakness or falls. The patient may seem like they are in a trance and perform actions without knowing it. This is different from the brief muscle weakness and fall seen in the patient. Option C, absence seizure, is incorrect because absence seizures are very brief and involve staring spells or a sudden lapse in awareness. They do not cause muscle weakness or falls. Absence seizures often happen in children and are hard to notice because the person just stops and stares for a few seconds. This is not what happened to the patient who suddenly lost muscle strength and fell. Option D, atonic seizure, is correct because atonic seizures, also known as drop attacks, cause sudden muscle weakness and make the person fall to the ground. These seizures are very brief, but can be dangerous because the person can get hurt when they fall. The nurse sees the sudden muscle weakness and fall and correctly identifies it as an atonic seizure. This next medication interaction question has shown up in the NCLEX exam 5 times in the last 5 years. Ready to dive in? The nurse is caring for a patient who has recently been prescribed warfarin to prevent blood clots. Which medication on the patient's current list should the nurse discuss with the primary healthcare provider, PHCP? A. Omeprazole. B. Cetirizine. C. Saw palmito. D. Hydrochlorothiazide. Pause, think, and comment your answer below. The correct answer is C. Saw palmetto. Here's why. Option A, omeprazole, is incorrect because omeprazole, a medication used to decrease stomach acid production in conditions like gastroesophageal
Stancoast,
reflux disease,
NCLEX coaching.
GERD, does not significantly interact with warfarin. Therefore, it does not necessitate specific follow-up with the PHCP when initiating warfarin therapy. Option B, cetirizine, is incorrect because cetirizine, an antihistamine commonly used to relieve allergy symptoms, does not interact significantly with warfarin. It does not influence warfarin's anticoagulant properties, so it is safe to use without requiring specific follow-up with the PHCP regarding warfarin therapy. Option C, saw palmetto, is correct because saw palmetto, a supplement used to treat symptoms of benign prostatic hyperplasia, BPH, can interact with warfarin by potentially enhancing its anticoagulant effects. This interaction increases the risk of bleeding. Warfarin is prescribed to prevent blood clots, and any substance that can potentiate its effect needs to be carefully monitored. The PHCP should be informed about the use of saw palmetto to consider any necessary adjustments to the warfarin dosage and to ensure proper monitoring to prevent complications such as hemorrhage. Option D, hydrochlorothiazide, is incorrect because hydrochlorothiazide, a diuretic commonly used to manage edema and hypertension, does not have significant interactions with warfarin. It does not affect the anticoagulant effectiveness of warfarin, making it safe to use concurrently without requiring special follow-up with the PHCP. Great job! Now let's move on to the next question. This next stroke treatment question has been featured 8 times in the last 5 years in the NCLEX exam. Ready to tackle this? A patient arrives in the emergency department with acute cerebellar infarction, presenting within 4.5 hours of symptom onset. Which of the following treatment options is most appropriate? A. Decompressive suboccipital craniotomy. B. Thrombolysis with recombinant tissue plasminogen activator, RTPA. C. External ventriculostomy. D. Mechanical thrombectomy. Pause, think, and comment your answer below. The correct answer is B. Thrombolysis with recombinant tissue plasminogen activator, RTPA. Here's why. Option A, decompressive suboccipital craniotomy, is incorrect because decompressive suboccipital craniotomy is a surgical procedure to remove part of the skull to relieve pressure in the brain's posterior fossa. While it may be necessary for severe cerebral edema, it is not the first-line treatment for acute cerebellar infarction within the initial hours of symptom onset. Option B, thrombolysis with recombinant tissue plasminogen activator, RTPA, is correct because for patients with acute cerebellar infarction presenting within 4.5 hours of symptom onset, thrombolysis. With RTPA is the most appropriate treatment. RTPA helps dissolve blood clots and restore blood flow in the affected artery. Administering RTPA within this critical time frame can significantly improve outcomes by minimizing brain damage and enhancing recovery. Option C, external ventriculostomy, is incorrect because ventriculostomy involves inserting a drainage catheter into the brain's ventricles to relieve increased intracranial pressure. This procedure might be necessary in cases of significant cerebral edema, but it is not the primary treatment for acute cerebellar infarction. Option D, mechanical thrombectomy, is incorrect because thrombectomy involves physically removing a blood clot from a blocked blood vessel. While it may be used in certain cases of ischemic stroke, it is not the first-line treatment for all patients with acute cerebellar infarction presenting within the critical window of 4.5 hours. Excellent! Let's move on to the next question. This next epidural analgesia preparation question has appeared 6 times in the past 5 years in the NCLEX exam. Patient is being prepared for continuous epidural analgesia in the emergency department. Which pre-procedure medication should the nurse be prepared to administer? A. Olanzapine. B. Metoclopramide. C. Lactated Ringer solution. D. Ibuprofen. All right, pause, think, and comment your answer below. The correct answer is C. Lactated Ringer's solution. Here's why. Option A, olanzapine, is incorrect because olanzapine is an antipsychotic medication used to treat conditions like schizophrenia. It has no relevance to the administration of an epidural analgesia and is not used in the pre-procedure setting for this purpose. Option B, metoclopramide, is incorrect because while nausea and vomiting can occur as side effects of epidural analgesia, it is not routine to administer antiemetics like metoclopramide preemptively before the procedure. The focus pre-procedure is more on preventing hypotension. Option C, lactated Ringer's solution, is correct because epidural analgesia commonly causes hypotension as a side effect. To mitigate this risk, it is standard practice to administer a liter of isotonic fluids, such as lactated Ringer's solution, before the procedure. This helps maintain blood pressure and ensures the patient's stability during and after the epidural administration. Option D, ibuprofen, is incorrect because ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, used to treat moderate pain. It is not typically administered before an epidural, as the epidural itself is intended to manage pain effectively. Nice work. Now let's move on to the next question. This next patient assessment question has been asked 4 times in the NCLEX exam in the past 5 years. Let's see how you handle it. During a routine round, the nurse finds a patient lying on the floor and appearing unresponsive. What should the nurse do first? A. Feel for the carotid pulse. B. Check the patient's breathing. C. Shout the patient's name and gently shake them. D. Call for emergency assistance. Take a moment, think, and comment your answer below. The correct answer is C. Shout the patient's name and gently shake them. Here's why. Option A, feel for the carotid pulse, is incorrect because while checking the pulse is important, it should follow after assessing whether the patient is responsive and breathing. The first priority is to determine if the patient can be aroused. Option B, check the patient's breathing, is incorrect because assessing the patient's breathing comes after determining their responsiveness. The initial step should be to see if the patient reacts to verbal or physical stimuli. Option C, shout the patient's name and gently shake them, is correct because the first action is to check if the patient can be awakened. This involves loudly calling their name and gently shaking them. This helps determine if they are truly unresponsive or just temporarily unconscious. If there is no response, the nurse should then proceed with further assessments such as checking breathing and circulation and calling for emergency assistance if necessary. This step ensures that the nurse can accurately gauge the patient's condition and respond appropriately. Option D, call for emergency assistance, is incorrect because the nurse should initially assess the patient's condition to determine the appropriate level of emergency response. Immediate calling for emergency assistance is premature without assessing if the patient is truly unresponsive. Great job. Let's move on to the next question. This next patient positioning question has been asked 7 times in the NCLEX exam over the past 5 years. Ready to tackle this? A student nurse asks the nurse about the proper head of bed elevation for a patient in Buck's traction. To ensure proper alignment and comfort, to what degree should the nurse elevate the head of the bed? A, 60 degrees. B, 15 degrees. C, 90 degrees. D, 45 degrees. Pause, think, and comment your answer below. The correct answer is B, 15 degrees. Here's why. Option A, 60 degrees, is incorrect because raising the head of the bed to 60 degrees is not suitable for a patient in Buck's traction. Although it is a common position for some other medical conditions, it does not provide the optimal alignment needed for effective traction. The recommended range is much lower, specifically between 10 and 20 degrees, to ensure proper traction alignment and prevent sliding. Option B, 15 degrees, is correct because for a patient in Buck's traction, skin traction, the head of the bed should be kept between 10 and 20 degrees. This positioning helps maintain proper alignment of the traction and prevents the patient from sliding down in the bed. By keeping the head of the bed at this slight elevation, the nurse ensures that the traction remains effective and that the patient experiences less discomfort from repositioning. Option C, 90 degrees, is incorrect because elevating the head of the bed to 90 degrees is excessive and not recommended for a patient in Buck's traction. Such a steep angle could lead to complications, including increased discomfort and potential misalignment of the traction setup. Option D, 45 degrees, is incorrect because elevating the head of the bed to 45 degrees is also not ideal for a patient in Buck's traction. While it might be appropriate for other conditions, it exceeds the recommended elevation range for Buck's traction, which is between 10 and 20 degrees. This higher elevation could compromise the traction's effectiveness and increase the patient's discomfort. Ready to elevate your NCLEX prep? Join our top-rated NCLEX review course today. Gain access to 10,000 questions from the past 5 years, 10 mock tests, 50 hours of engaging animated content, 1,000 hours of recorded lectures, daily 1-hour live classes at 9:00 p.m. Eastern Standard Time, and a comprehensive NCLEX prep ebook. Plus, enroll now and enjoy a 70% discount. Hurry, this special offer is available for a limited time only, and seats are filling up fast. Check the description for the link and secure your spot now. Pause the video to see why our NCLEX review course stands out from the rest. Make the smart choice and enroll in the best. We go with the 11th question. This one has been asked in the NCLEX exam 5 times over the past 5 years. It's important, so pay attention. A nurse is caring for multiple clients and must determine which task to prioritize first. Which action should the nurse take initially? Apply a nicotine patch to a patient who is trying to quit smoking and is experiencing strong cravings. B. Administer vancomycin prescribed by the doctor to a client with bacterial meningitis. C. Check vital signs for a client who had a percutaneous coronary intervention PCI 3 days ago. D. Administer diclofenac to a client with chronic back pain who reports pain rated 6 out of 10 on the numerical rating scale. Pause the video, think it through, and comment your answer below. Ready to see if you're right? Let's find out. The correct answer is B. Administer vancomycin prescribed by the doctor to a client with bacterial meningitis. Here's why. Option A. Apply a nicotine patch to a patient who is trying to quit smoking and is experiencing strong cravings is incorrect because while applying a nicotine patch can help manage a patient's cravings and support their effort to quit smoking, it is not as urgent as treating a life-threatening infection. The need for immediate antibiotic treatment in bacterial meningitis outweighs the urgency of nicotine patch application. Option B. Administer vancomycin prescribed by the doctor to a client with bacterial meningitis is correct because bacterial meningitis is a life-threatening condition that requires immediate antibiotic treatment. Any delay in administering antibiotics, such as vancomycin, can result in severe complications or death. Prompt administration of antibiotics is crucial to manage this critical condition effectively. Option C. Check vital signs for a client who had a percutaneous coronary intervention PCI 3 days ago is incorrect because while monitoring vital signs in a post-PCI client is important, it can usually be scheduled at regular intervals and is not as urgent as the immediate need to administer antibiotics for bacterial meningitis. Addressing the life-threatening infection takes precedence over routine post-operative monitoring. Option D. Administer diclofenac to a client with chronic back pain who reports pain rated 610 on the numerical rating scale is incorrect because while addressing pain is important, administering diclofenac to a client with chronic back pain rated 6 out of 10 is not as urgent as treating a life-threatening infection. Pain management for chronic conditions can typically be addressed after more critical interventions. Great job! Now, let's move on to the 12th question. This next question has been featured 4 times in the exam over the last 5 years. It's crucial, so let's get it right. The nurse has provided instructions to the parents of a child diagnosed with pinworm enterobiasis. Which parental statement reflects an accurate understanding of these instructions? A. I will have my child soak in a bath every evening. B. I will trim my child's nails regularly. C. I will reduce the frequency of my child washing their hands. D. I will keep my child home from school during the infection. Take a second, think it over, and leave your answer in the comments below. Ready for the reveal? Let's do it. The correct answer is B. I will trim my child's nails regularly. Here's why. Option A. I will have my child soak in a bath every evening is incorrect because bathwater can become contaminated with pinworm eggs, potentially leading to reinfection or spread to others. Option B. I will trim my child's nails. Regularly is correct because pinworm infections often cause severe itching around the anal area at night. Keeping the child's nails short helps prevent scratching that can lead to skin infections and reduces the chances of pinworm eggs getting trapped under the nails, which can cause reinfection or spread to others. Option C. I will reduce the frequency of my child. Washing their hands is incorrect because it is crucial for the child to wash their hands frequently, particularly after using the toilet. Pinworm eggs can survive under the nails. So proper hand hygiene is essential to prevent reinfection and the spread of the infection. Option D. I will keep my child home from school during the infection is incorrect because the child does not need to miss school if they practice good hand hygiene, which helps prevent the spread of pinworms. Proper hygiene measures are sufficient to manage the infection without the need for isolation. Fantastic. Now, let's move on to the 13th question. Here comes the 13th question, asked 6 times in the exam over the past 5 years. Let's see how you do with this one. A patient develops SIADH after undergoing cranial surgery for a craniopharyngioma. What symptom is most likely to be observed? A swelling in the extremities. B. Increased urine output. C. Slightly elevated or normal blood pressure. D. Low urine, specific gravity. Pause the video, consider your options, and drop your answer in the comments below. Ready to see the answer? Let's go. The correct answer is C, slightly elevated or normal blood pressure. Here's why. Option A, swelling in the extremities is incorrect because although there is fluid retention, it is distributed throughout the body and does not lead to peripheral edema. SIADH typically causes weight gain without peripheral edema. Option B, increased urine output, is incorrect because this symptom is typical of diabetes insipidus, a condition characterized by a lack of ADH or kidney response to ADH, resulting in excessive urination. SIADH causes decreased urine output due to water retention. Option C, slightly elevated or normal blood pressure, is correct because SIADH syndrome of inappropriate antidiuretic hormone secretion leads to abnormal retention of water due to excessive release of ADH. This causes dilutional hyponatremia and concentrated urine. Typical findings include low serum osmolality, high urine osmolality, normal skin turgor, weight gain without peripheral edema, and normal or slightly increased blood pressure. Option D, low urine. Specific gravity is incorrect because this finding is typical of diabetes insipidus, where the urine is dilute due to the inability to concentrate urine properly in SIADH. The urine is usually concentrated, resulting in high urine specific gravity. Well done. Let's continue with the 14th question. This one has appeared in the exam 3 times in the past 5 years. Pay close attention. What is true about the MMR, measles, mumps, and rubella vaccine? A people with EG allergies cannot receive this vaccine. B, the MMR vaccine consists of 3 doses and should begin immediately after birth. C, breastfeeding mothers can safely receive the MMR vaccine. D, it is advisable for pregnant women to get the MMR vaccine. Think carefully, then type your answer in the comments. Ready to see if you got it right. Here's the answer. The correct answer is C, breastfeeding mothers can safely receive the MMR vaccine. Here's why. Option A, people with EG allergies cannot receive this vaccine is incorrect because the MMR vaccine does not contain EG proteins, so it is safe for individuals with EG allergies. Option B, the MMR vaccine consists of 3 doses and should begin immediately after birth is incorrect because the MMR vaccine is typically administered in 2 doses, starting at 12-15 months and then at 46 years of age, not at birth. Option C, breastfeeding mothers can safely receive the MMR vaccine is correct because breastfeeding does not diminish the vaccine's effectiveness or negatively impact the infant. Option D, it is advisable for pregnant women to get the MMR vaccine is incorrect because the MMR vaccine is contraindicated during pregnancy due to the theoretical risk of live virus transmission to the fetus. Excellent. Now, let's move on to the 15th question. It's a common one, showing up 7 times in the NCLEX exam over the last 5 years. Let's dive in. A nurse is preparing a patient for a gastric analysis to diagnose Zollinger-Ellison syndrome, scheduled for 10 a.m. tomorrow morning. What should be included in the patient's pre-procedure instructions? A. Advise the patient to abstain from food and liquids after midnight. B. Inform the patient that chewing gum is allowed if feeling hungry. C. Explain that the patient should rest in bed for 2 hours following the procedure. D. Notify the patient that chewing tobacco is permitted up to 1 hour before the gastrin test. Hit the pause button, mull it over, and jot down your answer in the comments. Ready for the answer? Let's reveal it. The correct answer is advise the patient to abstain from food and liquids after midnight. Here's why. Option
Stancoast,
A,
NCLEX
advise the
coaching.
patient to abstain from food and liquids. After midnight is correct because gastric analysis, such as a gastric acid secretion test, which is often done to diagnose conditions like Zollinger-Ellison syndrome, requires that the patient have nothing by mouth NPO for 8 to 12 hours before the procedure to ensure accurate results. This involves inserting a nasogastric tube NGT and aspirating stomach contents to analyze pH, appearance, and volume. Option B. Inform the patient that chewing gum is allowed if feeling hungry is incorrect because the patient should avoid chewing gum and tobacco for at least 6 hours before the test, as these can stimulate gastric secretions and affect the results. Option C. Explain that the patient should rest in bed for 2 hours following the procedure is incorrect because there is no requirement for the patient to remain on bed rest. After the procedure, they can resume their normal activities immediately. Option D. Notify the patient that chewing tobacco is permitted up to 1 hour before the gastrin test is incorrect because chewing tobacco is also prohibited for at least 6 hours before the test, as it can interfere with the accuracy of the gastric analysis. Well done. Let's keep going with the 16th question. Which has appeared 4 times in the exam in the past 5 years. Let's tackle it. A nurse is about to administer a regular insulin IV bolus to a patient. The doctor has ordered an initial bolus dose of 0.1 unit per kilogram of body weight. The patient weighs 230 pounds. What dose of regular insulin should the nurse prepare to give? A 9 units, B 10 units, C 11 units, D 12 units. Pause the video, do the math, and post your answer in the comments below. Ready for the correct answer? Here it is. The correct answer is B 10 units. Here's why. Option B is correct. First, convert the patient's weight from pounds to kilograms. 230 pounds divided by 2.2 equals 104.55 kilograms, approximately 105 kilograms. Then, multiply the prescribed dose of 0.1 units by the patient's weight in kilograms. 0.1 units per kilogram times 105 kilograms equals 10.5 units. Rounding to the nearest whole number, the dose is 10 units. Choices A, C, and D are incorrect. These options result from miscalculations when converting weight or multiplying by the prescribed dose. Great. Let's move on to the 17th question. This question has appeared 6 times in the exam in the past 5 years. Pay close attention. A patient has been prescribed metformin for managing type 2 diabetes. Which statement by the patient indicates a proper understanding of the medication instructions? I should skip a dose if I don't eat many carbs that day. B, I might experience some bloating or diarrhea with this medication. C, I must check my blood sugar before taking each dose. D, this medication will help raise my hemoglobin, a 1C. Pause the video, think about it, and write your answer in the comments below. Ready to see if you got it right. Let's check. The correct answer is B. I might experience some bloating or diarrhea with this medication. Here's why. Option B. I might experience some bloating or diarrhea with this medication is correct because gastrointestinal side effects, such as bloating and diarrhea, are common with metformin. Especially at the start of treatment, taking metformin with meals or using an extended release formulation can help minimize these effects. Option A. I should skip a dose if I don't eat many carbs that day is incorrect. The medication should be taken consistently, regardless of daily carbohydrate intake. Option C. I must check my blood sugar before taking each dose is incorrect because metformin does not usually cause hypoglycemia, so checking blood sugar levels before each dose is unnecessary. Option D. This medication will help raise my hemoglobin. A 1C is incorrect. The primary goal of metformin is to lower hemoglobin a 1C levels, not to increase them. Fantastic. Let's move on to the 18th question. This one has been asked 5 times in the NCLEX exam over the past 5 years. Let's see how you do. A client has recently been diagnosed with acute kidney failure. Which psychosocial issues should the nurse prioritize in the care plan? A. Anxiety related to uncertainty about disease progression and treatment outcomes. B. Risk of infection due to invasive procedures and immunocompromised state. C. Social isolation due to dietary restrictions and altered lifestyle. D. Fluid overload resulting from compromised kidney function. Take a moment, consider your answer, and share it in the comments. Ready for the answer, here we go. The correct answer is A. Anxiety related to uncertainty about disease progression and treatment outcomes. Here's why. Option A. Anxiety related to uncertainty about disease progression and treatment outcomes is correct because it addresses the psychological concern of anxiety, which often arises from uncertainty regarding disease progression and treatment outcomes. Option B. Risk of infection due to invasive procedures and immunocompromised state is incorrect because it highlights the risk of infection from procedures and compromised immunity, which is a physiological risk rather than a psychosocial concern prioritized in the question. Option C. Social isolation due to dietary restrictions and altered lifestyle is incorrect because it emphasizes social isolation related to dietary restrictions and lifestyle changes, which are more related to social and lifestyle adjustments rather than primary psychosocial issues. Option D, fluid overload resulting from compromised kidney function, is incorrect because it focuses on fluid overload, a physiological concern associated with kidney failure rather than a psychosocial issue. Now, let's move on to the 19th question. This one has shown up 8 times in the exam in the past 5 years. It's important, so focus. A 74-year-old client with cardiac disease and asthma is receiving care from a nurse given the client's age and medical history. Which vaccination should the nurse prioritize recommending? A varicella vaccine. B. Tetanus vaccine. C. Pneumococcal vaccine. D. Meningococcal vaccine. Pause the video, think it through, and leave your answer in the comments. Ready for the reveal. Here's the answer. The correct answer is C. Pneumococcal vaccine. Here's why. Option A, varicella vaccine, is incorrect because the varicella vaccine is generally given to younger individuals or those who haven't had chickenpox, not to elderly clients with chronic health concerns like asthma and cardiac disease. Option B, tetanus vaccine, is incorrect because while tetanus vaccination is important, it does not specifically address the higher risks associated with the client's age and conditions. Option D, meningococcal vaccine, is incorrect because the meningococcal vaccine is typically recommended for adolescents and young adults in specific situations, not primarily for older adults with chronic diseases. The correct answer is C. Pneumococcal vaccine. The pneumococcal vaccine is crucial for adults aged 65 years and older, especially those with chronic conditions like asthma and cardiac disease. It helps prevent pneumococcal diseases such as pneumonia, which pose significant risks to elderly individuals. Excellent. Let's wrap it up with the 20th question. This one has been featured 7 times in the exam over the past 5 years. Let's see how you do. A nursing student working in a pediatric unit approaches the clinical nurse educator with a query about a nurse's legal obligations in cases involving suspected child abuse. What would be the most appropriate advice from the nurse educator? Nurses should consult with other healthcare professionals to gather more evidence before taking further steps. B nurses are obligated to promptly report any suspicions of child abuse to local child protection agencies or law enforcement. C nurses should initiate a conversation with the child's parents to discuss concerns about potential abuse. D nurses should discuss their suspicions with the healthcare provider HCP before taking any action. Pause, think, and type your answer in the comments below, ready for the answer. Here it is. The correct answer is B. Nurses are obligated to promptly report any suspicions of child abuse to local child protection agencies or law enforcement. Here's why. Option B is correct. According to legal requirements, nurses must report suspected child abuse without delay to the appropriate authorities. This ensures swift intervention to protect the child. Options A, C, and D are incorrect. Delaying to gather more evidence, discussing with parents, or only informing the healthcare provider may hinder timely intervention by the authorities, which is crucial in such cases. Transform your NCLEX prep with our premier review course. Enroll now to access 10,000 questions, 10 mock tests, 50 hours of animated content, 1,000 hours of recorded lectures, daily 1-hour live classes at 9 o'clock p.m. Eastern Standard Time, and a detailed NCLEX prep ebook. And the best news, enroll now and save 70%. This offer won't last long, and seats are limited. Check the description for the link and register now. Pause the video to view our comparison chart and discover why our NCLEX review course surpasses other providers. Make the best choice for your future and enroll today. This question has shown up in the exam 4 times over the past 5 years. So, pay close attention. A nurse is assessing the fluid balance of a client diagnosed with acute kidney injury. During the shift, the client received 630 milliliters of intravenous fluid, 7 ounces of water, and 9 ounces of chicken broth.
Stancoast,
The client's urinary
NCLEX
output
coaching.
for the shift is 790 milliliters. What is the total intake of fluids that the nurse should document for this client? A. 1020 milliliters. B. 1150 milliliters. C. 1050 milliliters. D. 1040 milliliters. Take a moment, pause the video, think about your answer, and type it in the comment box below. Let's see if you got it right. The correct answer is C. 1050 milliliters. Here's why. To calculate the total fluid intake. Water intake from 7 ounces. 7 ounces times 30 milliliters equals 210 milliliters. Fluid intake from 9 ounces of chicken broth. 9 ounces times 30 milliliters equals 270 milliliters. Intravenous fluid intake, 630 milliliters. Total fluid intake, 630 milliliters plus 210 milliliters plus 270 milliliters equals 1050 milliliters. Great job. Now let's move on to the next question. This next question is essential and has been asked in the NCLEX exam 6 times in the last 5 years. Are you ready? During a prenatal checkup, the healthcare provider is assessing a patient's risk for developing preeclampsia. Which of the following factors is least likely to contribute to the condition? A. Ethnicity. B. Persistent low blood pressure. C. Maternal age. D. Family history of preeclampsia. Take a moment, pause the video, think about your answer, and type it in the comment box below. Ready? Let's see if you got it right. The correct answer is B, persistent low blood pressure. Here's the rationale. Option B, persistent low blood pressure is correct because persistent low blood pressure, or chronic hypotension, is not considered a risk factor for preeclampsia. Preeclampsia is primarily associated with high blood pressure, defined as blood pressure readings exceeding 140 over 90 millimeters of mercury during pregnancy. Option A, ethnicity is incorrect because certain ethnicities, particularly African Americans, have a higher predisposition to developing preeclampsia. Option C, maternal age is incorrect because maternal age, particularly being 35 years or older, is known to increase the likelihood of preeclampsia due to physiological changes that occur with age. Option D, family history of preeclampsia is incorrect because having a family history of preeclampsia, especially in a first-degree relative like a mother or sister, significantly raises the risk of developing the condition during pregnancy. All right, fantastic. Now let's move to the next question. Now let's tackle this important question that has appeared 4 times in the NCLEX exam over the last 5 years. A patient has just received a dose of prescribed sumatriptan for migraine. Which observation would necessitate immediate attention from the nurse? A, complaint of nausea. B, blood pressure reading of 175 over 99 millimeters of mercury. C, continued headache. D, flushed appearance of the skin. Think you know the answer? Type it in the comment box. Don't forget, every comment you make gets you closer to evaluating your performance at the end. All right, let's check the answer. The correct answer is B, blood pressure reading of 175 over 99 millimeters of mercury. Here's why. Option B, blood pressure reading of 175 over 99 millimeters of mercury is correct because such a high blood pressure reading requires immediate attention, especially after administration of sumatriptan, which can cause vasoconstriction and potentially exacerbate hypertension. Option A, complaint of nausea is incorrect because nausea is a common side effect of sumatriptan and typically does not require immediate intervention unless it is severe or persistent. Option C, continued headache is incorrect because while a continued headache might need further management, it is not as urgent as addressing a high blood pressure reading. Option D, flushed appearance of the skin is incorrect because flushed skin is another common side effect of sumatriptan and usually does not require immediate intervention. Excellent! Now let's move on to the next question. This question has been featured 7 times in the exam in the past 5 years. Pay close attention. It's a critical one. A client admitted to the medical unit with pancreatitis has had their blood pressure taken by the unlicensed assistive personnel using the client's thigh. The nurse is aware that the blood pressure reading taken from the thigh compared to the arm will most likely show what change. A, the systolic reading will be reduced by 10 to 40 millimeters of mercury. B, the diastolic reading will be elevated by 10 to 40 millimeters of mercury. C, the systolic reading will be elevated by 10 to 40 millimeters of mercury. D, the diastolic reading will be reduced by 10 to 40 millimeters of mercury. Share your answer in the comment box. Remember, your comments are essential as they help you gauge your readiness for the exam. Let's reveal the answer. The correct answer is C. The systolic reading will be elevated by 10 to 40 millimeters of mercury. Here's the rationale. Option C. The systolic reading will be elevated by 10 to 40 millimeters of mercury is correct because blood pressure readings taken from the thigh typically show a higher systolic pressure by 10 to 40 millimeters of mercury compared to readings taken from the arm. This increase is primarily due to the increased distance from the heart and physiological differences in arterial structure. Option A. The systolic reading will be reduced by 10 to 40 millimeters of mercury is incorrect because the systolic reading in the thigh is not reduced but rather elevated when compared to the arm. Option B. The diastolic reading will be elevated by 10 to 40 millimeters of mercury is incorrect because the difference in blood pressure readings between the arm and thigh is primarily in the systolic reading, not the diastolic. Option D. The diastolic reading will be reduced by 10 to 40 millimeters of mercury is incorrect because the diastolic pressure is generally consistent between the arm and thigh, with significant variations occurring in the systolic measurements. Fantastic! Now, let's move on to the next question. This one has appeared in the exam 5 times in the past 5 years. Ready? When getting a client ready for a breast examination, how should the nurse position the client to ensure an optimal assessment? A. Lying on their back, with the arm on the side being examined positioned behind their head and a small cushion under the shoulder. B. Sitting upright with a cushion behind their shoulder blades and hands placed on their hips. C. Lying on their back with arms resting at their sides and a cushion beneath both knees. D. Positioned on their left side with their head on a pillow and the arm extended above their head. All right, pause the video, think, and comment your answer below. Let's see how prepared you are. The correct answer is A. Lying on their back, with the arm on the side being examined positioned behind their head and a small cushion under the shoulder. Here's why. Option A. Lying on their back, with the arm on the side being examined positioned behind their head and a small cushion under the shoulder is correct. For a thorough breast examination, the client should be positioned supine, with the arm of the side being examined placed behind their head. Additionally, a small cushion should be placed under the shoulder of the side being examined to enhance access and accuracy during palpation. This positioning allows for effective inspection and palpation of the breast tissue. Option B. Sitting upright with a cushion behind their shoulder blades and hands placed on their hips is incorrect because this position lacks the appropriate arm positioning for optimal breast examination. Option C. Lying on their back with arms resting at their sides and a cushion beneath both knees is incorrect because it lacks the necessary shoulder support and arm positioning. Now, let's move on to the next question. This next question is crucial and has been asked in the exam 8 times in the last 5 years. Are you ready? A patient diagnosed with generalized anxiety disorder is being treated with fluoxetine. The patient's medical history reveals concurrent use of tranylcypromine. The nurse should monitor for which signs that might suggest a severe drug interaction between these medications. A. Fatigue and excessive sweating. B. Chest pain and shortness of breath. C. Severe headache and sudden vision loss. D. Muscle stiffness and high fever. Take a moment, pause the video, think about your answer, and type it in the comment box below. Ready? Let's see if you got it right. The correct answer is D. Muscle stiffness and high fever. Here's the rationale. Option D. Muscle, stiffness, and high fever is correct because fluoxetine, a selective serotonin reuptake inhibitor, also known as SSRI, and tranylcypromine, a monoamine oxidase inhibitor, also known as MAOI, can interact dangerously when taken together, leading to serotonin syndrome. Serotonin syndrome occurs due to an excess of serotonin in the brain and can manifest with symptoms such as muscle stiffness, also known as rigidity, high fever, also known as hyperthermia, confusion, and autonomic instability. This condition requires immediate medical attention to prevent serious complications. Option A. Fatigue and excessive sweating is incorrect because fatigue and excessive sweating are nonspecific symptoms that could be associated with many conditions, including hypoglycemia or anxiety, but they are not key indicators of serotonin syndrome. Option B. Chest pain and shortness of breath is incorrect because chest pain and shortness of breath are symptoms that typically suggest a cardiovascular issue, such as a heart attack or pulmonary embolism, not serotonin syndrome. Option C. Severe headache and sudden vision loss is incorrect because severe headache and sudden vision loss are more indicative of a hypertensive crisis, which can also be a concern with MyOS, but is not specifically related to the interaction between fluoxetine and tranylcypromine. All right, fantastic! Now let's move to the next question. Now let's tackle this important question that has appeared 3 times in the NCLEX exam over the last 5 years. A pediatric patient is prescribed methylphenidate for attention deficit hyperactivity disorder, also known as ADHD. Which clinical observation should the nurse immediately communicate to the primary healthcare provider? A. Intermittent headaches. B. Reduction in body weight by 4 kilograms. C. Persistent dry mouth. D. Difficulty in initiating sleep. Think you know the answer? Type it in the comment box. Don't forget, every comment you make gets you closer to evaluating your performance at the end. All right, let's check the answer. The correct answer is B, reduction in body weight by 4 kilograms. Here's why. Option B. Reduction in body weight by 4 kilograms is correct because methylphenidate, a stimulant medication used to treat ADHD, can lead to significant weight loss in pediatric patients, which may impact their growth and development. A reduction of 4 kilograms in body weight is substantial and warrants immediate communication with the primary healthcare provider to assess and potentially modify the treatment plan to prevent further weight loss and associated complications. Option A. Intermittent headaches is incorrect because intermittent headaches are relatively common with methylphenidate use and often diminish over time. They do not generally pose the same immediate concern as a notable reduction in body weight. Option C. Persistent dry mouth is incorrect because persistent dry mouth is a known side effect of methylphenidate and can typically be managed with simple interventions such as chewing sugar-free gum or increasing fluid intake. While uncomfortable, it is not as critical as significant weight loss. Option D. Difficulty in initiating sleep is incorrect because difficulty in initiating sleep is another common side effect of stimulant medications. Adjusting the timing of the medication or incorporating sleep hygiene practices can help manage this issue, but it is not as urgent as significant weight loss. Fantastic! Now let's move on to the next question. This question has been featured 6 times in the exam in the past 5 years. Pay close attention. It's a critical one. A patient with a chest tube drainage system shows no fluctuation in the water seal chamber. What is the most likely explanation for this observation? A. The chest tube may have dislodged. B. Intrathoracic pressure has increased. C. The chest tube might be kinked or blocked. D. The lung may have collapsed. Share your answer in the comment box. Remember, your comments are essential as they help you gauge your readiness for the exam. Let's reveal the answer. The correct answer is C. The chest tube might be kinked or blocked. Here's the rationale. Option C. The chest tube might be kinked or blocked is correct because the lack of fluctuation in the water seal chamber usually suggests an issue with the chest tube drainage system's functionality. Potential reasons for this include the chest tube could be kinked, preventing fluid and air from moving freely. There might be fibrin clots blocking the tube, impeding proper drainage. The drainage system might be improperly positioned, creating dependent loops that hinder efficient drainage. These issues must be promptly identified and addressed to ensure the system functions correctly and to prevent complications. Option A. The chest tube may have dislodged is incorrect because while dislodgement could affect the drainage system, it would more likely lead to other noticeable problems. The more direct and common cause for no fluctuation is a blockage or kink in the chest tube. Option B, intrathoracic pressure has increased is incorrect because fluctuation in the water seal chamber corresponds to respiratory cycle changes in intrathoracic pressure. Complete cessation of fluctuation points more towards an obstruction or mechanical issue. Option D. The lung may have collapsed is incorrect because fluctuation typically indicates the lung is re-expanding and the drainage system is operating as intended. A lung collapse would usually present with different clinical signs. All right, let's move on to the next question. This one has appeared in the NCLEX exam 5 times in the past 5 years. Ready? A patient has been prescribed a bisphosphonate for the treatment of osteoporosis. Which instruction is most important for the nurse to include during patient education? A. Take this medication with a large meal. B. Take this medication right before going to bed. C. Take this medication in the morning while sitting or standing and with a full glass of water. D. This medication is suitable for patients with gastroesophageal reflux disease. All right, pause the video, think, and comment your answer below. Let's see how prepared you are. The correct answer is C. Take this medication in the morning while sitting or standing and with a full glass of water. Here's why. Option C. Take this medication in the morning while sitting or standing and with a full glass of water is correct because bisphosphonates should be taken first thing in the morning with a full glass of water. Patients must remain upright, sitting or standing, for at least 30 minutes after taking the medication and should not consume any food or other beverages during this time. This practice helps prevent esophageal irritation or damage, which can occur if the medication is not taken correctly. Option A. Take this medication with a large meal is incorrect because bisphosphonates should not be taken with a meal, as this can reduce the medication's absorption and effectiveness. Option B. Take this medication right before going to bed is incorrect because taking the medication at night is not advised. It is essential to remain upright for 30 minutes post-administration to prevent esophageal reflux or damage. Option D. This medication is suitable for patients with gastroesophageal reflux disease is incorrect because bisphosphonates are contraindicated for patients with esophageal disorders such as GERD due to the risk of esophageal irritation and damage. Fantastic! Let's move on to the next question. Let's wrap up with this question, which has been asked 7 times in the exam over the past 5 years. A patient is experiencing a tonic-clonic seizure. Which of the following medications should the nurse be prepared to administer as a first-line treatment? A. Carbamazepine. B. Atorvastatin. C. Lorazepam. D. Phenytoin. Pause, think, and comment your answer below. The correct answer is C. Lorazepam. Here's why. Option C. Lorazepam is correct because lorazepam is a benzodiazepine that acts quickly as an anticonvulsant, making it the first-line medication for terminating acute tonic-clonic seizures or status epilepticus. Its rapid onset of action when administered intravenously or intramuscularly allows it to effectively stop seizures promptly in emergency situations. Option A. Carbamazepine is incorrect because carbamazepine is used for long-term seizure control and has a slower onset of action, making it unsuitable for the immediate cessation of a tonic-clonic seizure. Option B. Atorvastatin is incorrect because atorvastatin is a statin used to lower cholesterol and is not relevant for managing seizures. Option D. Phenytoin is incorrect because although phenytoin is an anticonvulsant, it has a slower onset of action and is typically used for long-term seizure management rather than immediate seizure termination. Want to take your prep to the next level? Enroll in our comprehensive NCLEX review course. You'll get access to 10,000 questions from the past 5 years, 10 mock tests, 50 hours of animated content, 1,000 hours of recorded lectures,
Stancoast,
daily 1-hour
NCLEX
live
coaching.
classes at 9 p.m. Eastern Standard Time, and an exclusive NCLEX Prep ebook. And guess what? Enroll now and save 70%. This offer is for a limited time only, and seats are also limited. The link is in the description. Grab your spot now. Pause the video and check out this comparison chart to see why our NCLEX review course is the best compared to other course providers. Make an informed decision and choose the best. This question has popped up in the NCLEX exam 4 times over the past 5 years. It's super important, so listen up. During a prenatal visit, the nurse collects a clean catch urine specimen from the patient. The patient asks why this test is necessary. Which statement made by the nurse is incorrect? A. We check for ketones to monitor your glucose metabolism. B. We measure glucose levels to detect gestational diabetes. C. We screen for sexually transmitted infections using this sample. D. We assess TSH levels to monitor thyroid function. Take a moment, pause the video, think about your answer, and type it in the comment box below. Ready? Let's reveal the answer. The correct answer is D. We assess TSH levels to monitor thyroid function. Here's why. Option A. We check for ketones to monitor your glucose metabolism, is incorrect because ketones in the urine can indicate issues with glucose metabolism, such as gestational diabetes or inadequate carbohydrate intake, which are relevant to prenatal care. Option B. We measure glucose levels to detect gestational diabetes, is incorrect because monitoring glucose levels in the urine is crucial for detecting gestational diabetes, a condition that can develop during pregnancy and requires careful management. Option C. We screen for sexually transmitted infections using this sample, is incorrect because urine specimens can be used to screen for certain sexually transmitted infections, such as chlamydia and gonorrhea, which are important to identify and treat during pregnancy to prevent complications. Option D. We assess TSH levels to monitor thyroid function, is correct because TSH, thyroid stimulating hormone, levels are typically assessed through a blood test, not a urine sample. TSH tests are important for monitoring thyroid function, but require a blood sample rather than urine. Great job. Now let's move on to the next question. This next question is crucial and has been asked in the exam 6 times in the last 5 years. Are you ready? The nurse prepares a patient for a computed tomography scan of the brain with intravenous contrast following cerebral aneurysm surgery. What is the most critical information the nurse should provide to the patient before the scan? A. Instruct the patient to empty their bladder right before the test. B. Inform the patient that they might feel a warm sensation throughout their body during the injection of the contrast dye. C. Remove any medicated patches before the exam. D. Assess the patient for an implantable pacemaker. Take a moment. Pause the video, think about your answer, and type it in the comment box below. Ready? Let's see if you got it right. The correct answer is B. Inform the patient that they might feel a warm sensation throughout their body during the injection of the contrast dye. Here's the rationale. Option B. Inform the patient that they might feel a warm sensation throughout their body during the injection of the contrast dye is correct because patients undergoing a CT scan with intravenous contrast should be informed that they may experience a warm, flushing sensation when the contrast dye is administered. This sensation typically starts in the face and neck and may spread to other parts of the body, including the pelvic area. Option A, instruct the patient to empty their bladder right before the test, is incorrect because emptying the bladder before a CT scan is not usually necessary unless specifically instructed by the healthcare provider for a particular reason. Option C, remove any medicated patches before the exam, is incorrect because removing medicated patches is necessary for MRI scans due to potential burns caused by metal content in the patches, but it is not typically required for CT scans. Option D, assess the patient for an implantable pacemaker, is incorrect because assessing for an implantable pacemaker is relevant before an MRI scan due to the magnetic field, but it is not necessary for a CT scan. All right, fantastic. Let's move on to the next question. Now let's tackle this important question that has appeared 5 times in the NCLEX exam over the last 5 years. What is meant by ergonomic principles? A, reducing hospital-acquired infections. B, preventing genetic disorders. C, ensuring optimal posture and bodily alignment. D, implementing infection control measures. Think you know the answer? Type it in the comment box. Don't forget, every comment you make gets you closer to evaluating your performance at the end. All right, let's check the answer. The correct answer is C, ensuring optimal posture and bodily alignment. Here's why. Option C, ensuring optimal posture and bodily alignment, is correct because ergonomic principles focus on designing workspaces and tasks to ensure optimal posture and bodily alignment. This helps prevent musculoskeletal disorders and injuries by ensuring that individuals maintain correct posture and alignment during work activities. Option A, reducing hospital-acquired infections, is incorrect because reducing hospital-acquired infections involves infection control practices and hygiene measures in healthcare settings, which are not related to ergonomic principles. Option B, preventing genetic disorders, is incorrect because preventing genetic disorders involves genetic counseling and prenatal care and is not related to ergonomic principles focused on workplace design and human biomechanics. Option D, implementing infection control measures, is incorrect because infection control measures are focused on preventing the spread of infections in healthcare settings and are not related to ergonomic principles. Excellent! Now, let's move on to the next question. This question has been featured 3 times in the exam in the past 5 years. Pay close attention, it's a critical one. During a follow-up assessment, the nurse is evaluating a client prescribed carbidopa. Which clinical sign would indicate that the medication is effectively managing the client's condition? A, decrease in seizures. B, enhancement in muscle stiffness. C, reduction in tremors. D, improvement in excessive saliva. Drooling. Share your answer in the comment box. Remember, your comments are essential as they help you gauge your readiness for the exam. Let's reveal the answer. The correct answer is C, reduction in tremors. Here's the rationale. Option C, reduction in tremors, is correct because carbidopa is commonly prescribed for Parkinson's disease to alleviate motor symptoms, specifically tremors. A reduction in tremors indicates that the medication is effectively managing the client's Parkinson's symptoms, demonstrating therapeutic efficacy. Option A, decrease in seizures, is incorrect because seizures are not typically associated with Parkinson's disease. Medications for seizure control are not relevant to Parkinson's disease treatment. Option B, enhancement in muscle stiffness, is incorrect because muscle stiffness is not a primary symptom of Parkinson's disease and is more commonly associated with conditions like multiple sclerosis. Carbidopa primarily targets the motor symptoms specific to Parkinson's disease, such as tremors and rigidity. Option D, improvement in excessive saliva drooling, is incorrect because excessive saliva production, sialorrhea, is a symptom of Parkinson's disease, but is not directly treated by carbidopa. Other treatments may be needed for this symptom. This one has appeared in the NCLEX exam 8 times in the past 5 years. Ready? While caring for a client on a medical floor, the nurse would recognize that which diagnosis increases the client's risk of developing hyperkalemia. A. Cystic fibrosis. B. Bulimia nervosa. C. Acute renal failure. D. Cushing's syndrome. All right, pause the video, think, and comment your answer below. Let's see how prepared you are. The correct answer is C. Acute renal failure. Here's why. Option C, acute renal failure, is correct because acute renal failure impairs the kidney's ability to excrete potassium efficiently. Normally, healthy kidneys excrete 80 to 90% of the body's potassium. In acute renal failure, this excretion is compromised, leading to potassium retention and potential hyperkalemia. The condition may also lead to metabolic acidosis, further exacerbating potassium levels due to cellular shifts and impaired acid-base balance. Option A, cystic fibrosis, is incorrect because cystic fibrosis can predispose individuals to hypokalemia due to increased sweating, renal potassium wasting, and metabolic acidosis associated with the disease. It does not typically lead to hyperkalemia. Option B, bulimia nervosa, is incorrect because bulimia nervosa, characterized by purging behaviors such as vomiting and laxative use, can cause hypokalemia due to potassium losses from these actions. It does not increase the risk of hyperkalemia. Option D, Cushing's syndrome, is incorrect because Cushing's syndrome is associated with hypokalemia rather than hyperkalemia. Increased cortisol levels in Cushing's syndrome can lead to potassium depletion through increased urinary excretion and intracellular shifting. Let's dive into this question that has shown up in the NCLEX exam 4 times in the last 5 years. A client with congestive heart failure, CHF, is admitted with acute dyspnea, bilateral crackles, and generalized edema. Which medication should the nurse anticipate administering first? A. Metoprolol. B. Furosemide. C. Acetazolamide. D. Diltiazem. Pause the video, think, and comment your answer below. The correct answer is B. Furosemide. Here's why. Option B, furosemide, is correct because furosemide, a loop diuretic, is the first-line medication for managing acute exacerbations of congestive heart failure, CHF, with fluid volume excess. It promotes diuresis by inhibiting sodium and chloride reabsorption in the kidney tubules, thereby reducing fluid overload and alleviating symptoms such as dyspnea and edema. Option A, metoprolol, is incorrect because metoprolol is a beta blocker used to manage hypertension and reduce heart rate, not typically indicated in the acute management of CHF exacerbations. Option C, acetazolamide, is incorrect because acetazolamide is a carbonic anhydrase inhibitor diuretic primarily used for conditions such as glaucoma and altitude sickness, not typically indicated in the acute management of CHF exacerbations. Option D, diltiazem, is incorrect because diltiazem is a calcium channel blocker used to treat hypertension and cardiac arrhythmias, not typically indicated in the acute management of CHF exacerbations. Let's move on to this critical question, which has been featured 6 times in the last 5 years in the NCLEX exam. A nurse is reviewing the medications of a patient on the medical floor. Which of the following medications should the nurse recognize as having an increased risk of causing Stevens-Johnson syndrome, SJS? A. Levothyroxine. B. Lamotrigine. C. Citalopram. D. Metformin. Pause, think, and comment your answer below. The correct answer is B. Lamotrigine. Here's why. Option B, lamotrigine, is correct because lamotrigine, an anticonvulsant and mood stabilizer used to treat bipolar disorder and epilepsy, carries a significant risk of causing Stevens-Johnson syndrome, SJS. This severe and potentially life-threatening condition is characterized by a painful rash and involvement of mucous membranes. Lamotrigine can trigger SJS in susceptible individuals, necessitating careful monitoring for early signs and prompt discontinuation of the drug if SJS is suspected. Option A, levothyroxine, is incorrect because levothyroxine, a synthetic thyroid hormone used to treat hypothyroidism, is not linked to the risk of developing SJS. Option C, citalopram, is incorrect because citalopram, a selective serotonin reuptake inhibitor used for depression and anxiety disorders, is not associated with an increased risk of SJS. Option D, metformin, is incorrect because metformin, an oral anti-diabetic medication for type 2 diabetes, does not have a known association with SJS. Now, let's tackle another key question that has appeared 5 times in the past 5 years. A client with type 1 diabetes is seeking advice from the nurse about adjusting insulin levels when incorporating exercise into their routine. Which advice from the nurse is most accurate? A. Increased physical activity necessitates less insulin. B. Physical activity has no effect on insulin needs. C. Reduced physical activity necessitates less insulin. D. Increased physical activity necessitates more insulin. All right, pause the video, think, and comment your answer below. The correct answer is A. Increased physical activity necessitates less insulin. Here's why. Option A, increased physical activity necessitates less insulin, is correct because when a client with type 1 diabetes increases their physical activity, their body's sensitivity to insulin improves, leading to a reduced need for insulin. Exercise facilitates glucose uptake by muscle cells, which decreases blood glucose levels. Therefore, less insulin is required to manage blood glucose levels during and after exercise. It is essential for the client to monitor blood glucose levels before and after physical activity to prevent hypoglycemia. The nurse should educate the client on recognizing signs of low blood sugar and how to adjust their carbohydrate intake or insulin dosage accordingly to maintain stable glucose levels. Option B, physical activity has no effect on insulin needs, is incorrect since exercise significantly impacts insulin sensitivity and glucose metabolism, often requiring insulin adjustments. Option C, reduced physical activity necessitates less insulin, is incorrect because a decrease in physical activity typically increases insulin requirements due to less glucose being utilized by muscles. Option D, increased physical activity necessitates more insulin, is incorrect because exercise enhances insulin sensitivity, lowering insulin requirements. This question has been asked 8 times in the NCLEX exam in the past 5 years. Let's see how you handle it. During a physical examination of a client with ascites, the nurse needs to identify the area of tympany while the client is lying supine. Where should the nurse percuss? A. Lower abdomen beneath the umbilicus. B. Lateral sides of the abdomen. C. Central abdomen around the umbilicus. D. Each side of the lower back. Take a moment. Think and comment your answer below. The correct answer is C. Central abdomen around the umbilicus. Here's why. Option C. Central abdomen around the umbilicus is correct. In clients with ascites, fluid collects in the peritoneal cavity, causing the intestines to float. When the client is in a supine position, the nurse will typically hear tympany over the central abdomen around the umbilicus due to the presence of air-filled intestines floating on the acidic fluid. This helps distinguish between areas of fluid accumulation, dullness, and areas with less fluid, tympany. Accurate percussion is crucial for assessing the extent and distribution of acidic fluid, which aids in diagnosis and management. Option A, lower abdomen beneath the umbilicus, is incorrect because this area is likely to produce a dull sound because of fluid accumulation. Option B, lateral sides of the abdomen, is incorrect because this area often produces dullness due to fluid presence. Option D, each side of the lower back, is incorrect because the flanks usually accumulate fluid, resulting in dullness rather than tympany. Let's wrap up with this question, which has been asked 7 times in the NCLEX exam over the past 5 years. The nurse is preparing a 16-year-old client for a lumbar puncture to collect a cerebrospinal fluid, CSF, sample. Which position is ideal for this procedure? A. Lying on the side, lateral recumbent. B. Lying flat with legs elevated, Trendelenburg. C. Lying on the back, supine. D. Lying face down, prone. Pause, think, and comment your answer below. The correct answer is A. Lying on the side, lateral recumbent. Here's why. Option A, lying on the side, lateral recumbent, is correct. The lateral recumbent, side-lying position is optimal for a lumbar puncture. In this position, the client should curl into a fetal position with knees drawn up to the chest and head bent forward. This posture increases the space between the vertebrae, allowing easier access to the lumbar subarachnoid space for cerebrospinal fluid, CSF, sampling or medication administration. This position also helps in accurately measuring CSF pressure. Option B, lying flat with legs elevated, Trendelenburg, is incorrect because this position is not suitable for lumbar punctures. Option C, lying on the back, supine, is incorrect because the supine position does not provide the necessary access to the lumbar area for the procedure, although it may be used post-procedure to prevent headaches. Option D, lying face down, prone, is incorrect because this position is not practical for bedside lumbar punctures and is generally used for procedures needing imaging guidance. This is a critical scenario that tests your ability to respond swiftly to changes in a patient's condition. This question has been featured in the exam 4 times over the past 5 years. A patient in the intensive care unit is admitted with a brain injury and has been stable until just before the end of the shift when the monitor alarm sounds, showing a sudden drop in blood pressure. The nurse's initial response should be to A. Immediately assess the patient and provide necessary interventions. B. Continue with the shift handoff, mentioning the blood pressure drop. C. Silence the alarm and inform the incoming nurse about the patient's blood pressure drop. D. Adjust the alarm parameters to prevent further interruptions during the shift change. The correct answer is A. Immediately assess the patient and provide necessary interventions. Here's why. Option A, immediately assess the patient and provide necessary interventions, is correct because when an alarm indicates a critical change in a patient's condition, the nurse's priority is to assess the patient immediately. Delays in responding to a significant drop in blood pressure can lead to adverse outcomes. According to Maslow's hierarchy of needs, addressing physiological changes is paramount. Once the patient's immediate needs are met, the nurse can proceed with the shift handoff. Option B, continue with the shift handoff, mentioning the blood pressure drop, is incorrect because while communicating changes during handoff is important, immediate patient assessment and intervention take precedence. Option C, silence the alarm and inform the incoming nurse about the patient's blood pressure drop, is incorrect because silencing the alarm without assessing the patient is dangerous as it delays critical intervention. Option D, adjust the alarm parameters to prevent further interruptions during the shift change, is incorrect because changing alarm settings to avoid interruptions compromises patient safety. Let's move on to the next question. Let's dive into another important question that has been asked in the NCLEX exam 6 times in the last 5 years. A patient is prescribed an insulin infusion at a rate of 12 milliliters per hour. The infusion bag contains 50 units of insulin in 100 milliliters of saline. Calculate the hourly insulin dosage the patient is receiving. Provide your answer rounded to the nearest whole number. A 6 units per hour, B 3 units per hour, C 7 units per hour, D 5 units per hour. The correct answer is A 6 units per hour. Here's why. To determine the hourly insulin dosage. Determine the concentration of insulin in the solution. 50 units divided by 100 milliliters equals 0.5 units per milliliter. Calculate the infusion rate. 12 milliliters per hour times 0.5 units per milliliter equals 6 units per hour. Thus, the patient receives 6 units of insulin per hour. Option A, 6 units per hour, is correct because it correctly calculates the infusion rate. Option B, 3 units per hour, is incorrect because it miscalculates the infusion rate. Option C, 7 units per hour, is incorrect because it miscalculates the infusion rate. Option D, 5 units per hour, is incorrect because it miscalculates the infusion rate. Now, let's move on to the next question. Here's a question that has shown up in the NCLEX exam 5 times over the past 5 years. A nurse is preparing the discharge plan for a patient who is paralyzed due to a spinal cord injury. What is the most appropriate component to include in the care plan? A. Arranging long-term care as the patient will be unable to perform self-care. B. Implementing a rehabilitation plan early in the treatment process. C. The patient and family will arrange for rehabilitation services. D. Planning for short-term rehabilitation, expecting the patient to return to normal activities. Pause for a moment, think carefully, and comment your answer below. The correct answer is B. Implementing a rehabilitation plan early in the treatment process. Here's why. Option B, implementing a rehabilitation plan early in the treatment process, is correct because early rehabilitation is crucial for optimizing recovery and adjustment to new limitations following a spinal cord injury. Rehabilitation services should start as soon as the patient is stable to promote the best outcomes. Early involvement of case managers and rehabilitation specialists helps set goals and facilitate the transition to appropriate services. Option A, arranging long-term care as the patient will be unable to perform self-care, is incorrect because not all spinal cord injury patients require long-term care. Rehabilitation aims to maximize independence. Option C, the patient and family will arrange for rehabilitation services, is incorrect because the healthcare team should guide the patient and family through this process. Option D, planning for short-term rehabilitation, expecting the patient to return to normal activities, is incorrect because rehabilitation needs vary widely. Expecting a return to pre-injury activities without comprehensive rehab is unrealistic. All right, let's move on to the next question. Let's move on to this critical question, which has been featured 7 times in the last 5 years in the NCLEX exam. During the assessment of a patient with a suspected P. pneumothorax, which clinical finding should the nurse expect? A. Pleural friction rub. B. Blood-tinged sputum. C. Decreased breath sounds on one side. D. Barrel-shaped chest. Pause the video, think, and comment your answer below. The correct answer is C. Decreased breath sounds on one side. Here's why. Option C, decreased breath sounds on one side, is correct because a pneumothorax or collapsed lung typically presents with decreased or absent breath sounds on the affected side due to the presence of air in the pleural space. Other symptoms may include chest pain and difficulty breathing, with severity depending on the extent of lung collapse. Option A, pleural friction rub, is incorrect because it is associated with pleuritis or pleural effusion, not typically pneumothorax. Option B, blood-tinged sputum, is incorrect because this is more indicative of infections or other pulmonary conditions. Option D, barrel-shaped chest, is incorrect because it is often seen in chronic obstructive pulmonary disease, COPD, not pneumothorax. Let's move on to the next question. This is an important question that has appeared in the exam 4 times in the past 5 years. An oncology nurse is monitoring a patient receiving doxorubicin through an intravenous line. Which observation requires the nurse to take immediate action? A. Persistent abdominal discomfort. B. Development of painful mouth sores. C. Notable pain and swelling at the intravenous site. D. Onset of severe nausea and vomiting. Pause for a moment, think carefully, and comment your answer below. The correct answer is C. Notable pain and swelling at the intravenous site. Here's why. Option C, notable pain and swelling at the intravenous site, is correct because notable pain and swelling at the intravenous site are classic signs of extravasation, which occurs when a vesicant chemotherapy drug like doxorubicin leaks into the surrounding tissue. Vesicants can cause significant tissue damage, including blistering and necrosis, if not promptly addressed. The nurse should immediately stop the infusion, disconnect the intravenous line, and attempt to aspirate the drug from the tissue to minimize damage. The nurse must then notify the healthcare provider and follow the established protocol for managing extravasation, which may involve antidotes and the application of warm or cold compresses, depending on the specific medication. Option A, persistent abdominal discomfort, is incorrect because abdominal pain can stem from various causes, such as gastrointestinal disturbances due to chemotherapy, but does not indicate extravasation and does not require immediate intervention related to the intravenous site. Option B, development of painful mouth sores, is incorrect because this is typically a result of mucositis, a common side effect of chemotherapy, which requires treatment but does not necessitate immediate action related to the intravenous infusion. Option D, onset of severe nausea and vomiting, is incorrect because while these are distressing side effects of chemotherapy, they are not related to extravasation and can be managed with antiemetic medications. Now, let's move on to the next question. Here's another question that has been asked in the NCLEX exam 6 times over the past 5 years. A nurse is caring for a newborn diagnosed with erythroblastosis fetalis. Which underlying cause is primarily responsible for this condition? A. Deformation of red blood cells leading to oxygen transport issues. B. Accumulation of an amino acid due to a metabolic disorder. C. Hemolysis of the newborn's red blood cells caused by maternal antibodies. D. Excessive production of red blood cells due to bone marrow stimulation. Pause for a moment, think carefully, and comment your answer below. The correct answer is C. Hemolysis of the newborn's red blood cells caused by maternal antibodies. Here's why. Option C. Hemolysis of the newborn's red blood cells caused by maternal antibodies is correct because erythroblastosis fetalis, also known as hemolytic disease of the newborn, occurs when maternal antibodies attack the fetal red blood cells due to blood type incompatibility, often involving the Rh factor. This leads to hemolysis, which can result in severe anemia, jaundice, and potential heart failure in the newborn if not treated. Administering Rho-D immune globulin, RhoGAM, to Rh-negative mothers can prevent the production of antibodies against Rh-positive fetal blood cells. Option A, deformation of red blood cells leading to oxygen transport issues, is incorrect because this describes sickle cell anemia, a genetic disorder that is unrelated to erythroblastosis fetalis. Option B, accumulation of an amino acid due to a metabolic disorder, is incorrect because this describes phenylketonuria, PKU, a condition that is not related to erythroblastosis fetalis. Option D, excessive production of red blood cells due to bone marrow stimulation, is incorrect because this describes polycythemia, which is unrelated to erythroblastosis fetalis. Let's move on to the next question. Let's tackle this question that has appeared 5 times in the last 5 years in the NCLEX exam. A patient has undergone a large volume paracentesis. To prevent hypovolemic shock, which infusion is most appropriate for the nurse to anticipate the primary healthcare provider to prescribe? A. 0.9% saline. B. Albumin. C. Dextrose 5%. D. Mannitol. Pause for a moment, think carefully, and comment your answer below. The correct answer is B. Albumin. Here's why. Option B, albumin, is correct because albumin is administered post-paracentesis to maintain oncotic pressure and prevent hypovolemic shock by drawing fluid back into the bloodstream. After the removal of a significant volume of acidic fluid, albumin helps prevent a sudden drop in blood pressure and stabilizes the patient's intravascular volume without causing fluid overload. Option A, 0.9% saline, is incorrect because while this isotonic solution can help with fluid replacement, it is not as effective as albumin in preventing fluid shifts after large volume paracentesis. Option C, dextrose 5%, is incorrect because while this solution provides some fluid replacement and energy, it does not have the oncotic properties of albumin to effectively prevent hypovolemic shock after a large volume paracentesis. Option D, mannitol, is incorrect because it is used to decrease intracranial pressure and is not suitable for preventing hypovolemic shock after paracentesis. Let's move on to the next question. This question has been asked 8 times in the NCLEX exam over the past 5 years. Let's see how you handle it. A nurse is monitoring a patient with a pulmonary embolism. Which symptom requires the most immediate follow-up? A. Exertional dyspnea. B. Pleuritic chest pain. C. Restlessness. D. Cough. Take a moment. Think and comment your answer below. The correct answer is C. Restlessness. Here's why. Option C, restlessness, is correct because restlessness can be a sign of hypoxia, indicating that the PE may be causing significant respiratory compromise. This symptom warrants immediate assessment and intervention to ensure adequate oxygenation and to prevent further deterioration of the patient's condition. Option A, exertional dyspnea, is incorrect because this is expected in PE patients, but does not require immediate follow-up unless it progresses to severe respiratory distress. Option B, pleuritic chest pain, is incorrect because this is a common symptom of PE and, while concerning, does not necessarily indicate immediate deterioration. Option D, cough, is incorrect because a cough is a typical symptom of PE and does not require immediate intervention unless it worsens. Let's move on to the next question. This question has been featured 4 times in the NCLEX exam in the past 5 years. Let's dive in. The nurse is assessing a patient in myxedema coma. Which laboratory finding is expected? A. Serum sodium of 150 milliequivalents per liter. B. Blood glucose of 57 milligrams per deciliter. C. Serum pH of 7.49. D. Body temperature of 101 degrees Fahrenheit. Take a moment. Think and comment your answer below. The correct answer is B. Blood glucose of 57 milligrams per deciliter. Here's why. Option B, blood glucose of 57 milligrams per deciliter, is correct because myxedema coma is a severe hypothyroid state that can lead to hypoglycemia
Stancoast,
due to
NCLEX
decreased
coaching.
metabolic activity. Low blood glucose levels are a common finding in this condition, which requires prompt management to stabilize the patient. Option A, serum sodium of 150 milliequivalents per liter, is incorrect because hypernatremia is not typical in myxedema coma. Hyponatremia is more common. Option C, serum pH of 7.49, is incorrect because alkalosis is uncommon in myxedema coma. Metabolic acidosis is more likely. Option D, body temperature of 101 degrees Fahrenheit, is incorrect because hyperthermia is not expected in myxedema coma. Hypothermia is more typical due to the reduced metabolic rate. Let's move on to the next question. and has been asked 6 times in the last 5 years in the NCLEX exam. Before starting an intravenous infusion of phenytoin for a patient with epilepsy, what should the nurse do? A. Insert an indwelling urinary catheter. B. Set up continuous EEG monitoring. C. Obtain a peak serum level before starting the infusion. D. Establish continuous cardiac monitoring. Pause for a moment, think carefully, and comment your answer below. The correct answer is D. Establish continuous cardiac monitoring. Here's why. Option D, establish continuous cardiac monitoring, is correct because phenytoin can cause significant cardiac arrhythmias, making continuous cardiac monitoring essential during its infusion. This precaution allows for the prompt detection and management of potential adverse cardiac effects, ensuring patient safety. Option A, insert an indwelling urinary catheter, is incorrect because this is not necessary for phenytoin administration and does not relate to the medication's potential adverse effects. Option B, set up continuous EEG monitoring, is incorrect because EEG monitoring is not necessary during phenytoin infusion. It is used to evaluate seizure activity, but not required for phenytoin administration. Option C, obtain a peak serum level before starting the infusion, is incorrect because monitoring phenytoin levels typically involves checking trough levels, not peak levels, to ensure therapeutic dosing. Ready to elevate your NCLEX prep? Join our top-rated NCLEX review course today. Gain access to 10,000 questions from the past 5 years, 10 mock tests, 50 hours of engaging animated content, 1,000 hours of recorded lectures, daily 1-hour live classes at 9:00 p.m. Eastern Standard Time, and a comprehensive NCLEX prep ebook. Plus, enroll now and enjoy a 70% discount. Hurry, this special offer is available for a limited time only, and seats are filling up fast. Check the description for the link and secure your spot now. Pause the video to see why our NCLEX review course stands out from the rest. Make the smart choice and enroll in the best. This question highlights characteristics of personality disorders. It has been asked 5 times in the last 5 years in the NCLEX exam. A 40-year-old patient has a long history of job hopping and conflicts with work superiors. They tell the nurse that it is hard to please people and that things would be better if people were not critical of me. Based on what they tell the nurse, why is the patient representative of patients with a personality disorder? A. Lack of personal discernment and finding fault with others are characteristics of personality disorder. B. People who are opinionated are usually suffering from a personality disorder. C. People with personality disorders usually have fairly good judgment, but can be very defensive. D. Personality disorders are characterized by stable relationships. Take a moment to think and comment your answer below. The correct answer is A. Lack of personal discernment. And finding fault with others are characteristics of personality disorder. Here's why. Option A, lack of personal discernment and finding fault with others are characteristics of personality disorder, is correct because lack of personal discernment and blaming others are common traits in personality disorders, reflecting inflexible and maladaptive personality traits. Option B, people who are opinionated are usually suffering from a personality disorder, is incorrect because being opinionated alone does not indicate a personality disorder. Option C, people with personality disorders usually have fairly good judgment but can be very defensive, is incorrect because while defensiveness can occur, poor judgment is more typical. Option D, personality disorders are characterized by stable relationships, is incorrect because personality disorders often involve unstable relationships and difficulties in social interactions. Let's move on to the next question. This question about side effects of medication has been featured 7 times in the last 5 years in the exam. A patient has been taking bismuth subsalicylate for the treatment of acute diarrhea. The patient tells the nurse he is concerned about his stool being black and the possibility of a gastrointestinal bleed. What should the nurse do? A. Ask the patient if he has had a colonoscopy. B. Get a stool sample for a guaiac test. C. Assure the patient that this is a normal side effect of this medication. D. Immediately inform the physician. Take a moment, think, and comment your answer below. The correct answer is C. Assure the patient that this is a normal side effect of this medication. Here's why. Option C, assure the patient that this is a normal side effect of this medication, is correct because bismuth subsalicylate can cause black stools, a harmless side effect due to the medication's composition. Option A, ask the patient if he has had a colonoscopy, is incorrect because a colonoscopy inquiry is irrelevant to the side effect caused by the medication. Option B, get a stool sample for a guaiac test, is incorrect because a guaiac test is unnecessary as the black stool is a known benign side effect. Option D, immediately inform the physician, is incorrect because informing the physician is not needed for this well-documented side effect. Great job! Now let's move on to the next question. This question on psychiatric disorders has appeared 4 times in the last 5 years in the exam. The nurse is caring for a patient diagnosed with schizoaffective disorder. This disorder contains elements of schizophrenia and elements of which of the following disorders? A. Thought disorder. B. Amnestic disorder. C. Personality disorder. D. Mood disorder. Pause for a moment, think carefully, and comment your answer below. The correct answer is D. Mood disorder. Here's why. Option D, mood disorder, is correct because schizoaffective disorder combines symptoms of schizophrenia with mood disorder symptoms such as depression or mania. Option A, thought disorder, is incorrect because thought disorder is a term often used to describe symptoms of schizophrenia itself, which is already part of the schizoaffective diagnosis. Option B, amnestic disorder, is incorrect because amnestic disorder involves memory impairment and is unrelated to the mood disturbances seen in schizoaffective disorder. Option C, personality disorder, is incorrect because personality disorder involves enduring patterns of behavior and thinking, but does not typically include psychotic symptoms like those in schizophrenia. Fantastic! Let's proceed to the next question. This common medication side effect question has been asked 6 times in the last 5 years in the NCLEX exam. A patient using tretinoin gel tells the nurse his skin is peeling. What should the nurse do? A. Tell the patient to discontinue the medication. B. Call the physician immediately. C. Tell the patient to apply the gel less frequently. D. Reassure the patient that this is normal. Take a moment to think and comment your answer below. The correct answer is D. Reassure the patient that this is normal. Here's why. Option D, reassure the patient that this is normal, is correct because skin peeling is a common reaction to tretinoin as it increases cell turnover. Option B, call the physician immediately, is incorrect because calling the physician is unnecessary for a common side effect. Option A, tell the patient to discontinue the medication, is incorrect because discontinuing the medication should be discussed with a physician, not decided independently by the nurse. Option C, tell the patient to apply the gel less frequently, is incorrect because changing the regimen should also be discussed with a physician. Great work. Let's move on to the next question. This question about pediatric anxiety disorders has appeared 5 times in the last 5 years in the NCLEX exam. A 7-year-old child is brought to the school clinic complaining of stomach pain and fears of his mother being in an automobile accident. After performing a physical examination and talking to his mother, the school nurse finds no physical basis for the child's stomach aches or fears. Which of the following anxiety disorders is he more than likely experiencing? A. Social phobia. B. Obsession. C. Specific phobia. D. Separation anxiety. Take a moment, think, and comment your answer below. The correct answer is D. Separation anxiety. Here's why. Option D, separation anxiety, is correct because separation anxiety is characterized by excessive fear or anxiety about separation from home or loved ones, often resulting in physical symptoms like stomach aches due to worry about harm befalling their caregivers. Option A, social phobia, is incorrect because social phobia is characterized by fear of social situations and being judged by others, which doesn't fit the context of the boy's fears about his mother. Option B, obsession, is incorrect because obsession involves recurrent, persistent, intrusive thoughts or images that cause distress, which is not indicated by the boy's fears. Option C, specific phobia, is incorrect because specific phobia involves an intense, irrational fear of specific objects or situations, not relevant to the boy's concerns about his mother's safety. Well done. Now let's proceed to the next question. This question about adverse drug reactions in pediatrics has been asked 8 times in the last 5 years in the NCLEX exam. A toddler diagnosed with leukemia is being treated with mercaptopurine. The nurse expects which of the following as adverse reactions? Select all that apply. A. Leukopenia. B. Respiratory failure. C. Thrombocytopenia. D. Anemia. E. Renal failure. F. Sedation. Take a moment to think and comment your answers below. The correct answers are A. Leukopenia, C. Thrombocytopenia, D. Anemia. Here's why. Option A, leukopenia, is correct because mercaptopurine causes myelosuppression, leading to leukopenia. Option C, thrombocytopenia, is correct because mercaptopurine causes myelosuppression, leading to thrombocytopenia. Option D, anemia, is correct because mercaptopurine causes myelosuppression, leading to anemia. Option B, respiratory failure, is incorrect because respiratory failure is not a typical adverse effect. Option E, renal failure, is incorrect because renal failure is not commonly associated with mercaptopurine. Option F, sedation, is incorrect because sedation is not a common side effect of mercaptopurine. Great job! Let's move on to the next question. This physiological question has been featured 3 times in the last 5 years in the NCLEX exam. A right shift of the oxygen-hemoglobin dissociation curve favors oxygen release to tissues. What causes this right shift to occur? A. Increased 2,3-diphosphoglycerate. B. Decreased pH. C. Exercise. D. All choices are correct. E. Increased partial pressure of carbon dioxide. Pause for a moment. Think and comment your answer below. The correct answer is D. All choices are correct. Here's why. Option A, increased 2,3-diphosphoglycerate, is correct because increased 2,3-diphosphoglycerate binds to hemoglobin and decreases its oxygen affinity. Option B, decreased pH, is correct because decreased pH, acidosis, reduces hemoglobin's affinity for oxygen, promoting oxygen release. Option C, exercise, is correct because exercise increases metabolic activity, producing more carbon dioxide and hydrogen ions, leading to a right shift. Option E, increased partial pressure of carbon dioxide, is correct because increased partial pressure of carbon dioxide lowers the affinity of hemoglobin for oxygen. Option D, all choices are correct, is correct because all listed factors contribute to a rightward shift in the oxygen-hemoglobin dissociation curve, enhancing oxygen release to tissues. Excellent! Let's proceed to the next question. This question about renal health has been asked 7 times in the last 5 years in the exam. A 65-year-old client reports severe left lumbar pain and is diagnosed with kidney stones. What dietary change is most helpful in preventing recurrence? A. Spinach. B. Eggs. C. Water. D. Steak. Take a moment, think, and comment your answer below. The correct answer is C. Water. Here's why. Option C, water, is correct because increasing water intake helps prevent the recurrence of kidney stones by diluting urine and reducing stone formation. Option A, spinash, is incorrect because spinach contains oxalate, which can contribute to kidney stones. Option B, eggs, is incorrect because eggs can increase the risk of uric acid stones. Option D, steak, is incorrect because high protein intake from steak can increase the risk of certain types of kidney stones. Well done. Let's move on to the next question. This question on medication administration timing has appeared 4 times in the last 5 years in the exam. A patient prescribed labetalol. 100 milligrams twice a day is scheduled to receive hemodialysis. The nurse should administer the labetalol. A. During dialysis. B. 12 hours after dialysis. C. Before dialysis. D. After dialysis. Pause for a moment. Think and comment your answer below. The correct answer is D. After dialysis. Here's why. Option D, after dialysis, is correct because to avoid hypotension during dialysis, antihypertensive medications like labetalol should be administered afterward. Option A, during dialysis, is incorrect because administration during dialysis could cause hypotension. Option B, 12 hours after dialysis, is incorrect because 12 hours after dialysis is an unnecessary delay. Option C, before dialysis, is incorrect because administration before dialysis could cause hypotension. Great job! Let's move on to the next question. This question about psychiatric disorders has been asked 6 times in the last 5 years in the NCLEX exam. The nurse is caring for a patient diagnosed with dissociative identity disorder. During the examination, the nurse would expect which of the following symptoms? Select all that apply. A. Depression. B. Intense egocentrism. C. Loss of time.
Stancoast.
D.
NCLEX coaching.
Sense of superiority and exhibitionism. E. The patient being told by others of behavior he or she does not recall. F. Use of different voices. Take a moment to think and comment your answers below. The correct answers are A. Depression. C. Loss of time. E. The patient being told by others of behavior he or she does not recall. F. Use of different voices. Here's why. Option A, depression, is correct because depression is often seen in patients with dissociative identity disorder due to the emotional turmoil associated with the condition. Option C, loss of time, is correct because patients may experience amnesia for certain periods, often when another personality is in control. Option E, the patient being told by others of behavior he or she does not recall, is correct because individuals may be unaware of actions taken by their alternate identities. Option F, use of different voices, is correct because distinct identities often have different manners of speaking. Option B, intense egocentrism, is incorrect because intense egocentrism is more characteristic of narcissistic personality disorder. Option D, sense of superiority and exhibitionism, is incorrect because a sense of superiority and exhibitionism is typically seen in antisocial or narcissistic personality disorders, not dissociative identity disorder. Fantastic! Let's proceed to the next question. This post-operative care question has appeared 5 times in the last 5 years in the NCLEX exam. After a cleft palate repair, why should the use of a drinking straw be avoided? A. It will lead to aspiration. B. It can interfere with air exchange. C. It can tear the suture line. D. It can cause bruising of the tissue. Pause for a moment. Think and comment your answer below. The correct answer is C. It can tear the suture line. Here's why. Option C, it can tear the suture line, is correct because suction from using a straw can disrupt the surgical site, leading to potential tears and delayed healing. Option A, it will lead to aspiration, is incorrect because using a straw does not directly cause aspiration post-surgery. Option B, it can interfere with air exchange, is incorrect because air exchange is not significantly affected by straw use. Option D, it can cause bruising of the tissue, is incorrect because bruising is less likely compared to the risk of suture disruption. Well done! Now let's proceed to the next question. This question about medication side effects has been featured 7 times in the last 5 years in the NCLEX exam. The nurse administers quinidine intravenously to control an arrhythmia for a patient with mitral valve prolapse. The nurse understands that which of the following is a common adverse reaction to the drug? Select all that apply. A. Dizziness. B. A rash. C. Abdominal cramping. D. Diarrhea. E. Syncope. Take a moment to think and comment your answers below. The correct answers are A. Dizziness. C. Abdominal cramping. D. Diarrhea. Here's why. Option A, dizziness, is correct because dizziness is a common side effect of quinidine related to its effects on the central nervous system. Option C, abdominal cramping, is correct because abdominal cramping is a common side effect of quinidine related to its effects on the gastrointestinal system. Option D, diarrhea, is correct because diarrhea is a common side effect of quinidine related to its effects on the gastrointestinal system. Option B, a rash, is incorrect because a rash is less common and not one of the primary adverse effects. Option E, syncope, is incorrect because syncope is rare but more serious, not one of the common side effects. Great job. Let's move on to the next question. This LAB result interpretation question has been asked 4 times in the last 5 years in the exam. The nurse is reviewing the lab results of a patient taking warfarin for atrial fibrillation. Which of the following international normalized ratio values would the nurse consider therapeutic for this patient? A. 3.1, B. 0.8, C. 1.8, D. 2.4. Pause for a moment. Think and comment your answer below. The correct answer is D. 2.4. Here's why. Option D, 2.4, is correct because for patients on warfarin, especially those with atrial fibrillation, the therapeutic international normalized ratio range is typically 2.0 to 3.0. An international normalized ratio of 2.4 falls within this range, indicating effective anticoagulation. Option A, 3.1, is incorrect because an international normalized ratio of 3.1 is slightly above the therapeutic range, increasing the risk of bleeding and may require a dosage adjustment. Option B, 0.8, is incorrect because an international normalized ratio of 0.8 is below the therapeutic range, indicating insufficient anticoagulation. Option C, 1.8, is incorrect because an international normalized ratio of 1.8 is slightly below the therapeutic range, suggesting the need for dosage adjustment. Fantastic! Let's proceed to the next question. This question about medication administration has appeared 6 times in the last 5 years in the NCLEX exam. A patient has been prescribed pancrelipus due to pancreatic insufficiency. The nurse should instruct the patient to A. Chew until the medication is dissolved. B. Swallow it whole and do not chew. C. Take it in the morning. D. Take it at bedtime. Take a moment. Think and comment your answer below. The correct answer is B. Swallow it whole and do not chew. Here's why. Option B, swallow it whole and do not chew, is correct because pancrelipus is enteric coated to prevent gastric irritation and ensure it reaches the small intestine. Chewing or crushing it can destroy the coating and reduce its effectiveness. Option A, chew until the medication is dissolved, is incorrect because chewing destroys the enteric coating, causing gastric irritation and reducing efficacy. Options C and D, take it in the morning, take it at bedtime, are incorrect because the timing is less important than ensuring it is taken with meals to aid digestion. Great job. Let's move on to the next question. This pediatric condition question has been asked 5 times in the last 5 years in the exam. The parents of a newborn ask the nurse to identify the chief danger associated with a tracheoesophageal fistula. What should the nurse tell them? A. Esophageal dilatation. B. Aspiration into the lungs. C. Difficulty in maintaining suction. D. Gastroesophageal reflux. Pause for a moment. Think and comment your answer below. The correct answer is B. Aspiration into the lungs. Here's why. Option B, aspiration into the lungs, is correct because a tracheoesophageal fistula allows food and fluids to enter the trachea and lungs, leading to aspiration and potential respiratory complications. Option A, esophageal dilatation, is incorrect because esophageal dilatation is not the primary concern. Option C, difficulty in maintaining suction, is incorrect because maintaining suction is not the primary concern. Option D, gastroesophageal reflux, is incorrect because gastroesophageal reflux is not the primary concern. Well done. Now let's proceed to the next question. This question about schizophrenia and brain changes has appeared 8 times in the last 5 years in the exam. The nurse is reviewing radiographic images of a patient with schizophrenia. The nurse should be alert for which of the following brain changes? A. Decreased third ventricle size. B. Increased blood flow. C. Decreased brain tissue. D. Altered sensorium. Take a moment. Think and comment your answer below. The correct answer is C. Decreased brain tissue. Here's why. Option C, decreased brain tissue, is correct because schizophrenia is often associated with reduced brain volume, particularly in the frontal and temporal lobes, and enlarged ventricles. Option A, decreased third ventricle size, is incorrect because decreased third ventricle size is not characteristic of schizophrenia. Option B, increased blood flow, is incorrect because increased blood flow is not characteristic of schizophrenia. Option D, altered sensorium, is incorrect because altered sensorium is a clinical symptom rather than an imaging finding. Excellent! Let's proceed to the next question. This question on infectious diseases has been featured 3 times in the last 5 years in the NCLEX exam. A labor and delivery patient presents with a rash and lymphadenopathy. Lab tests show positive non-troponemal antibody. The nurse should A. Ask about drug use. B. Encourage fluid intake. C. Notify the physician immediately. D. Place the patient in a specific position. Take a moment, think, and comment your answer below. The correct answer is C. Notify the physician immediately. Here's why. Option C, notify the physician immediately, is correct because a positive non-troponemal test with a rash and lymphadenopathy suggests secondary syphilis, which requires immediate medical intervention to prevent complications. Option A, ask about drug use, is incorrect because asking about drug use is not immediately relevant to the diagnosis and management of secondary syphilis. Option B, encourage fluid intake, is incorrect because although fluid intake is important, it is not the primary intervention needed in this situation. Option D, place the patient in a specific position, is incorrect because placing the patient in a specific position is not relevant to the management of secondary syphilis. Great job! Let's move on to the next question. This obstetric complication question has appeared 7 times in the last 5 years in the NCLEX exam. A patient with oligohydramnios presents to the hospital with intense contractions. Which of the following complications is associated with this condition? Select all that apply. A. Cord compression. B. Renal malformations. C. Lesion of cranial nerve 6. D. Hypospadias. E. Skeletal malformations. Take a moment to think and comment your answers below. The correct answers are A. Cord compression. B. Renal malformations. E. Skeletal malformations. Here's why. Option A, cord compression, is correct because low amniotic fluid can lead to umbilical cord compression, which can compromise fetal oxygenation. Option B, renal malformations, is correct because oligohydramnios is often associated with fetal renal anomalies since amniotic fluid is largely produced by fetal urine. Option E, skeletal malformations, is correct because insufficient amniotic fluid can restrict fetal movement, leading to skeletal abnormalities. Option C, lesion of cranial nerve 6, is incorrect because lesion of cranial nerve 6 affects the cranial nerve and is unrelated to amniotic fluid levels. Option D, hypospadias, is incorrect because hypospadias is a congenital condition affecting the urethra, not typically linked to oligohydramnios. Well done. Let's move on to the next question. This question about interpreting arterial blood gas results has been asked 4 times in the last 5 years in the NCLEX exam. The nurse admits a client in the emergency department and performs an arterial blood gas. The results are pH 7.51, partial pressure of carbon dioxide 49, partial pressure of oxygen 85, and bicarbonate 35. Which of the following describes this arterial blood gas result? A. Compensated respiratory acidosis. B. Uncompensated metabolic alkalosis. C. Uncompensated metabolic acidosis. D. Partially compensated metabolic alkalosis. Take a moment to think and comment your answer below. The correct answer is D. Partially compensated. Metabolic alkalosis. Here's why. Option D, partially compensated metabolic alkalosis, is correct because the elevated pH indicates alkalosis. The increased bicarbonate indicates a metabolic cause, and the elevated partial pressure of carbon dioxide suggests the respiratory system is attempting to compensate, but not fully. Option A, compensated respiratory acidosis, is incorrect because compensated respiratory acidosis would have a low pH and high partial pressure of carbon dioxide with normal or elevated bicarbonate. Option B, uncompensated metabolic alkalosis, is incorrect because uncompensated metabolic alkalosis would have a high pH and high bicarbonate without elevated partial pressure of carbon dioxide. Option C, uncompensated metabolic acidosis, is incorrect because uncompensated metabolic acidosis would have a low pH and low bicarbonate with normal partial pressure of carbon dioxide. Fantastic! Let's proceed to the next question. This question on labor and delivery management has appeared 6 times in the last 5 years in the NCLEX exam. A woman who has been in labor for 6 hours is now 9 centimeters dilated and has intense contractions every 1 to 2 minutes. She is anxious and feels the need to bear down with her contractions. What is the best action for the nurse to take? A. Reposition her in a squatting position to make her more comfortable. B. Allow her to push so that the delivery can be expedited. C. Encourage panting through contractions to prevent pushing. D. Provide back rubs during contractions to distract her. Pause for a moment. Think and comment your answer below. The correct answer is C. Encourage pant. Inhale through contractions to prevent pushing. Here's why. Option C, encourage panting through contractions to prevent pushing, is correct because encouraging the woman to pant can help prevent premature pushing, allowing the cervix to fully dilate to 10 centimeters. reducing the risk of cervical lacerations and excessive bleeding. Option A, reposition her in a squatting position to make her more comfortable, is incorrect because repositioning can facilitate labor but is not appropriate if the cervix is not fully dilated and the urge to push needs to be controlled. Option B, allow her to push so that the delivery can be expedited, is incorrect because allowing her to push could lead to cervical damage and increase the risk of complications if the cervix is not fully dilated. Option D, provide back rubs during contractions to distract her, is incorrect because back rubs might provide comfort but do not address the need to delay pushing. Great job! Let's move on to the next question. This birth control question has been featured 5 times in the last 5 years in the NCLEX exam. A nurse is caring for a patient in need of birth control. The patient questions the nurse about the diaphragm. Which of the following are correct? Select all that apply. A, the diaphragm is in place at all times. B, the diaphragm should be left in place for 6 hours after intercourse. C, spermicide is needed. D, spermicide is not needed. E, the diaphragm should be removed immediately after intercourse. F, the diaphragm is recommended for monogamous women. Take a moment to think and comment your answers below. The correct answers are B, the diaphragm should be left in place for 6 hours after intercourse. C, spermicide is needed. F, the diaphragm is recommended for monogamous women. Here's why. Option B, the diaphragm should be left in place for 6 hours after intercourse, is correct because the diaphragm should be left in place for 6 hours after intercourse to ensure that sperm are immobilized and do not reach the cervix. Option C, spermicide is needed, is correct because spermicide enhances the effectiveness of the diaphragm by killing sperm. Option F, the diaphragm is recommended for monogamous women, is correct because diaphragms do not protect against sexually transmitted infections, making them more suitable for women in stable monogamous relationships. Option A, the diaphragm is in place at all times, is incorrect because the diaphragm is not meant to be in place at all times. Option D, spermicide is not needed, is incorrect because spermicide is essential for the effectiveness of the diaphragm. Option E, the diaphragm should be removed immediately after intercourse, is incorrect because removing the diaphragm immediately after intercourse reduces its effectiveness, as spermicide needs time to work. Fantastic! Let's proceed to the next question. This psychiatric condition question has appeared 7 times in the last 5 years in the NCLEX exam. A patient comes to the emergency department complaining of fears of being contaminated by her college roommates. She admits that since entering college several months ago, she has been showering at least 6 times a day because of these fears and anxiety. She also admits knowing that her behavior does not make sense. Which of the following most accurately describes this condition? A, germophobia. B, severe generalized anxiety disorder. C, obsessive-compulsive disorder. D, schizophrenia. Take a moment. Think and comment your answer below. The correct answer is C, obsessive-compulsive disorder. Here's why. Option C, obsessive-compulsive disorder, is correct because obsessive-compulsive disorder, OCD, is characterized by recurrent, intrusive thoughts, obsessions, and repetitive behaviors, compulsions, performed to reduce anxiety. The patient recognizes the irrational nature of her behavior, which is typical of OCD. Option A, germophobia, is incorrect because germophobia is a layman's term that can describe OCD but lacks clinical precision. Option B, severe generalized anxiety disorder, is incorrect because severe generalized anxiety disorder, GAD, involves pervasive anxiety and worry without the specific compulsive behaviors seen in OCD. Option D, schizophrenia, is incorrect because schizophrenia involves psychotic symptoms like delusions and hallucinations, which are not relevant here. Well done. Let's move on to the next question. This question on pediatric mental health assessment has been featured 4 times in the last 5 years in the NCLEX exam. A 7-year-old foster child is brought to the clinic. The child was abused by her parents before going into foster care. As part of a psychosocial assessment to rule out any chronic dissociative pattern of coping, the nurse would ask about which of the following. Select all that apply. A. Presence of auditory or visual hallucinations. B. Ability to play or interact with other children. C. Odd, contradictory displays of behavior. D. The presence of other siblings in the home. E24. Our nutritional intake. Take a moment to think and comment your answers below. The correct answers are B. Ability to play or interact with other children. C. Odd, contradictory displays of behavior. E. 24-hour nutritional intake. Here's why. Option B, ability to play or interact with other children, is correct because the ability to play or interact with other children can reveal coping mechanisms or social withdrawal. Option C, odd, contradictory displays of behavior, is correct because odd, contradictory displays of behavior can indicate dissociative patterns as a coping mechanism for trauma. Option E, 24-hour nutritional intake, is correct because changes in appetite or eating habits can indicate stress or trauma. Option A, presence of auditory or visual hallucinations, is incorrect because the presence of auditory or visual hallucinations is more indicative of psychotic disorders rather than dissociation. Option D, the presence of other siblings in the home, is incorrect because the presence of other siblings in the home is relevant for family dynamics, but not directly indicative of dissociative coping. Great job! Let's move on to the next question. This maternal and fetal health question has appeared 6 times in the last 5 years in the NCLEX exam. A patient planning pregnancy asks about fetal alcohol syndrome. Which statement indicates understanding? A. Beer is safe to drink during pregnancy. B. Wine with meals is acceptable. C. Large amounts of alcohol are needed to harm the fetus. D. Alcohol can harm the fetus even before pregnancy is known. Take a moment to think and comment your answer below. The correct answer is D. Alcohol can harm the fetus even before pregnancy is known. Here's why. Option D, alcohol can harm the fetus even before pregnancy is known, is correct because alcohol can affect fetal development during the early weeks of pregnancy, often before the woman knows she is pregnant. Therefore, avoiding alcohol when planning pregnancy is crucial. Option A, beer is safe to drink during pregnancy, is incorrect because no amount of alcohol is considered safe during pregnancy. Option B, wine with meals is acceptable, is incorrect because consuming alcohol with meals does not mitigate its harmful effects on fetal development. Option C, large amounts of alcohol are needed to harm the fetus, is incorrect because even small amounts of alcohol can harm the fetus, particularly during early pregnancy. Fantastic! Let's proceed to the next question. This medication administration safety question has appeared 5 times in the last 5 years in the NCLEX exam. The nurse is caring for an adult client with a remote history of a gastrointestinal bleed and a recent myocardial infarction. The healthcare provider prescribed daily enteric-coated aspirin. Which of the following statements would require correction by the nurse? A. I can chew or swallow my aspirin whole. B. I should report coffee ground emesis or terry stools. C. I should never chew my aspirin. D. I should never give my aspirin to my 1-year-old child. Take a moment to think and comment your answer below. The correct answer is A. I can chew or swallow my aspirin whole. Here's why. Option A, I can chew or swallow my aspirin whole, is correct because enteric-coated aspirin should not be chewed, as this can damage the coating designed to prevent gastric irritation. The patient should be instructed to swallow it whole. Option B, I should report coffee ground emesis or Terry stools, is incorrect because reporting coffee ground emesis or Terry stools is correct. These are signs of gastrointestinal bleeding and should be reported immediately. Option C, I should never chew my aspirin, is incorrect because never chewing enteric-coated aspirin is correct advice. Option D, I should never give my aspirin to my 1-year-old child, is incorrect because not giving aspirin to a young child is correct due to the risk of Reye's syndrome. Transform your NCLEX prep with our premier review course. Enroll now to access 10,000 questions, 10 mock tests, 50 hours of animated content, 1,000 hours of recorded lectures, daily 1-hour live classes at 9:00 p.m. Eastern Standard Time, and a detailed NCLEX Prep ebook. And the best news, enroll now and save 70%. This offer won't last long, and seats are limited. Check the description for the link and register now. Pause the video to view our comparison chart and discover why our NCLEX review course surpasses other providers. Make the best choice for your future and enroll today. This question on brain changes in schizophrenia has been asked 8 times in the last 5 years in the NCLEX exam. The nurse is reviewing radiographic images of a patient with schizophrenia. The nurse should be alert for which of the following brain changes? A. Decreased third ventricle size. B. Increased blood flow. C. Decreased brain tissue. D. Altered sensorium. Take a moment. Think and comment your answer below. The correct answer is C. Decreased brain tissue. Here's why. Option C, decreased brain tissue, is correct because schizophrenia is often associated with reduced brain volume, particularly in the frontal and temporal lobes and enlarged ventricles. Option A, decreased third ventricle size, is incorrect because typically ventricles are enlarged in schizophrenia, not decreased in size. Option B, increased blood flow, is incorrect because usually there is decreased blood flow in certain brain areas in schizophrenia, not increased. Option D, altered sensorium, is incorrect because altered sensorium is a clinical symptom rather than an imaging finding. Now, let's look at another important question. This question about dissociative identity disorder symptoms has appeared 3 times in the last 5 years in the NCLEX exam. The nurse is caring for a patient diagnosed with dissociative identity disorder. During the examination, the nurse would expect which of the following symptoms? Select all that apply. A. Depression. B. Intense egocentrism. C. Loss of time. D. Sense of superiority and exhibitionism. E. The patient being told by others of behavior he or she does not recall. F. Use of different voices. Take a moment to think and comment your answers below.
Stancoast.
The correct
NCLEX
answers
coaching.
are A. Depression. C. Loss of time. E. The patient being told by others of behavior he or she does not recall. F. Use of different voices. Here's why. Option A, depression, is correct because depression is often seen in patients with dissociative identity disorder due to the emotional turmoil associated with the condition. Option C, loss of time, is correct because patients may experience amnesia for certain periods, often when another personality is in control. Option E, the patient being told by others of behavior he or she does not recall, is correct because individuals may be unaware of actions taken by their alternate identities. Option F, use of different voices, is correct because distinct identities often have different manners of speaking. Option B, intense egocentrism, is incorrect because intense egocentrism is more characteristic of narcissistic personality disorder. Option D, sense of superiority and exhibitionism, is incorrect because a sense of superiority and exhibitionism is typically seen in antisocial or narcissistic personality disorders, not dissociative identity disorder. Moving on to the next question. This question on metformin overdose and its complications has been featured 7 times in the last 5 years in the NCLEX exam. A patient with type 2 diabetes ingested 5 times the usual dose of metformin after a procedure involving iodine contrast. What side effect is most likely to occur? A. Renal failure. B. Arrhythmias. C. Hyperglycemia. D. Hypoglycemia. Think about it. Comment your answer below. The correct answer is A. Renal failure. Here's why. Option A, renal failure, is correct because metformin combined with contrast agents can increase the risk of renal failure, particularly in overdose situations. Option B, arrhythmias, is incorrect because arrhythmias are not commonly associated with metformin. Option C, hyperglycemia, is incorrect because metformin generally lowers blood glucose, not causes hyperglycemia. Option D, hypoglycemia, is incorrect because hypoglycemia is less common with metformin as it doesn't increase insulin secretion. Let's proceed to the next topic. This medication administration question has appeared 4 times in the last 5 years in the NCLEX exam. A patient has been prescribed pancrelipase due to pancreatic insufficiency. The nurse should instruct the patient to A. Chew until the medication is dissolved. B. Swallow it whole and do not chew. C. Take it in the morning. D. Take it at bedtime. Think it through. Comment your answer below. The correct answer is B. Swallow it whole and do not chew. Here's why. Option B, swallow it whole and do not chew, is correct because pancrelipase is enteric-coated to prevent gastric irritation and ensure it reaches the small intestine. Chewing or crushing it can destroy the coating and reduce its effectiveness. Option A, chew until the medication is dissolved, is incorrect because chewing destroys the enteric coating, causing gastric irritation and reducing efficacy. Option C, take it in the morning, is incorrect because taking it in the morning is less important than ensuring it is taken with meals to aid digestion. Option D, take it at bedtime, is incorrect because taking it at bedtime is not effective for aiding digestion during meals. Next up, we have another critical question. This pediatric condition question has been asked 6 times in the last 5 years in the NCLEX exam. When planning ongoing nursing care for a child with recurrence of nephrotic syndrome, which of the following potential disturbances should be the priority consideration? A. Sexual maturation. B. Body image. C. Cognitive development. D. Psychological development. Think about it. Comment your answer below. The correct answer is B. Body image. Here's why. Option B, body image, is correct because children with nephrotic syndrome often experience edema, which can significantly impact their body image and self-esteem. Option A, sexual maturation, is incorrect because sexual maturation is less relevant in the context of nephrotic syndrome recurrence. Option C, cognitive development, is incorrect because cognitive development, while important, is secondary to the immediate concerns of physical appearance and social interactions. Option D, psychological development, is incorrect because psychological development is important, but the priority is body image due to the visible and immediate effects of the syndrome. On to the next question. This nutritional requirement question for hemodialysis patients has appeared 5 times in the last 5 years in the NCLEX exam. A nurse should instruct a client receiving hemodialysis to eat meals containing how much protein? A. 0.5 grams per kilogram per day. B. 0.60 to 1.0 grams per kilogram per day. C. 1.2 grams per kilogram per day. D. 2 to 3 grams per kilogram per day. Take a moment. Think and comment. Your answer below. The correct answer is C, 1.2 grams per kilogram per day. Here's why. Option C, 1.2 grams per kilogram per day, is correct because the recommended protein intake for hemodialysis patients is to ensure adequate nutrition and prevent muscle wasting. Option A, 0.5 grams per kilogram per day, is incorrect because 0.5 grams per kilogram per day is insufficient protein intake. Option B, 0.60 to 1.0 grams per kilogram per day, is incorrect because 0.60 to 1.0 grams per kilogram per day is below the recommended range for hemodialysis patients. Option D, 2 to 3 grams per kilogram per day, is incorrect because 2 to 3 grams per kilogram per day is excessive and unnecessary, which could lead to complications. Let's continue with another question. This pediatric respiratory emergency question has been featured 7 times in the last 5 years in the NCLEX exam. An 18-month-old girl is admitted to the hospital with acute laryngotracheobronchitis. She is placed in a mist tent with compressed air. Which of these symptoms would be an early sign of hypoxia? A. Barking cough. B. Flushing of the face. C. Increased restlessness. D. Mouth breathing. The correct answer is C. Increased restlessness. Here's why. Option C, increased restlessness, is correct because increased restlessness is an early sign of hypoxia as the body becomes anxious due to insufficient oxygen levels. Option A, barking cough, is incorrect because barking cough is characteristic of croup but not a direct sign of hypoxia. Option B, flushing of the face, is incorrect because flushing is not typically related to hypoxia. Option D, mouth breathing, is incorrect because mouth breathing is common in respiratory distress but not a specific early sign of hypoxia. Let's move on to another question. This question on COPD management has appeared 4 times in the last 5 years in the NCLEX exam. A patient with chronic obstructive pulmonary disease, COPD, is feeling short of breath and has an oxygen saturation of 86% on room air. The nurse auscultates inspiratory and expiratory wheezes. The nurse applies a nasal cannula at a rate of 2 liters per minute. What should the nurse do next? A. Call respiratory therapy to administer the prescribed levobuterol nebulizer treatment. B. Notify the physician immediately. C. Prepare the patient for an emergent intubation. D. Stay with the patient until the respiratory status improves. Take a moment, think and comment your answer below. The correct answer is A. Call respiratory therapy to administer the prescribed levobuterol nebulizer treatment. Here's why. Option A, call respiratory therapy to administer the prescribed levobuterol nebulizer treatment, is correct because administering a bronchodilator can help open the airways and improve breathing. Option B, notify the physician immediately, is incorrect because while important, notifying the physician is not the immediate priority over initial treatment. Option C, prepare the patient for an emergent intubation, is incorrect because preparing for emergent intubation is premature unless severe respiratory distress persists. Option D, stay with the patient until the respiratory status improves, is incorrect because staying with the patient is supportive but does not address the need for immediate treatment. Here's another question for you. This pediatric emergency question has been asked 6 times in the last 5 years in the NCLEX exam. A 3-year-old boy is found choking by his mother after ingesting an earring. His mother immediately rushes him to the hospital. What emergency measures should the nurse do for a child who has aspirated a foreign object? A. Abdominal thrusts. B. Back blows. C. Chest thrusts. D. Finger sweeping of the mouth. Think it through. Comment your answer below. The correct answer is A. Abdominal thrusts. Here's why. Option A, abdominal thrusts, is correct because abdominal thrusts are recommended for children over 1 year to dislodge an aspirated object. Option B, back blows, is incorrect because back blows are more appropriate for infants. Option C, chest thrusts, is incorrect because chest thrusts are more appropriate for infants. Option D, finger sweeping of the mouth, is incorrect because finger sweeping should only be done if the object is visible. Blind sweeps can push the object further down. Let's tackle another question. This documentation protocol question has appeared 5 times in the last 5 years in the NCLEX exam. A nurse has left the hospital for the weekend and remembers forgetting to chart a urine output in the electronic medical record, EMR, for a client. The nurse should correct this by A. Call the registered nurse who took over for that client and have them chart the output in the electronic medical record. B. Calling the nursing assistant still on duty and ask them to chart the output in the electronic medical record. C. Make a late entry on Monday in the electronic medical record. D. Make an addendum on Monday in the electronic medical record. Take a moment. Think and comment your answer below. The correct answer is D. Make an addendum on Monday in the electronic medical record. Here's why. Option D, make an addendum on Monday in the electronic medical record, is correct because an addendum is the proper procedure for late documentation in the medical record, ensuring accuracy and accountability. Option A, call the registered nurse who took over for that client and have them chart the output in the electronic medical record, is incorrect because delegating personal documentation to another nurse is inappropriate and breaches protocol. Option B, calling the nursing assistant still on duty and ask them to chart the output in the electronic medical record, is incorrect because asking the nursing assistant to chart personal documentation is inappropriate and breaches protocol. Option C, make a late entry on Monday in the electronic medical record, is incorrect because a late entry is less appropriate than an addendum for clarity and transparency. Here's another question for you. This question on measles symptoms has been featured 7 times in the last 7 years in the NCLEX exam. A teenager is seen in the clinic due to a mild respiratory infection. The nurse observes Koplik spots on the oral mucosa. After seeing this, the nurse next inspects A. Peripheral circulation, B. The ears, C. The lungs, D. The skin. Think about it. Comment your answer below. The correct answer is D. The skin. Here's why. Option D, the skin, is correct because Koplik's spots are indicative of measles, which typically presents with a skin rash. Checking the skin helps confirm the diagnosis. Option A, peripheral circulation, is incorrect because peripheral circulation is less directly related to the immediate identification of measles following the observation of Koplik's spots. Option B, the ears, is incorrect because inspecting the ears is less directly related to the immediate identification of measles. Option C, the lungs, is incorrect because inspecting the lungs is less directly related to the immediate identification of measles. Let's move forward with another question. This immunization question has appeared 3 times in the last 5 years in the NCLEX exam. A nurse is preparing to administer human immune globulin to a patient. The nurse explains to the patient that these types of vaccines are A. Decreased in potency to facilitate active immunity, B. Inactive toxic compounds that cause illness, C. Killed microbes that provide active immunity, D. Obtained from pooled human blood and provide antibodies to several diseases. Think it through. Comment your answer below. The correct answer is D, obtained from pooled human blood and provide antibodies to several diseases. Here's why. Option D, obtained from pooled human blood and provide antibodies to several diseases, is correct because human immune globulin contains antibodies derived from pooled human blood, providing passive immunity against multiple diseases, and is used for immediate protection. Option A, decreased in potency to facilitate active immunity, is incorrect because decreased potency refers to live attenuated vaccines, not applicable here. Option B, inactive toxic compounds that cause illness, is incorrect because inactive toxic compounds refer to toxoid vaccines. Option C, killed microbes that provide active immunity, is incorrect because killed microbes refer to inactivated vaccines, which stimulate active immunity. Let's continue with the next question. This competency verification question has appeared 8 times in the last 5 years in the NCLEX exam. The nurse needs to know a patient's blood glucose and asks the unlicensed assistive personnel, UAP, if she has been trained on finger sticks per facility protocol. The assistant says she has not been officially trained at this facility, but has performed finger sticks at a previous job. What should the nurse do? A. Ask another nurse to perform the finger stick. B. Let the unlicensed assistant perform the fingerstick unsupervised. C. Perform the fingerstick herself. D. Perform the fingerstick while the unlicensed assistant observes, and then document this in the unlicensed assistant's training log. The correct answer is D. Perform the fingerstick while the unlicensed assistant observes, and then document this in the unlicensed assistant's training log. Here's why. Option D, perform the fingerstick while the unlicensed assistant observes, and then document this in the unlicensed assistant's training log, is correct because performing the fingerstick while the unlicensed assistant observes ensures the unlicensed assistant is properly trained according to facility protocols and can safely perform the task in the future. Option A, ask another nurse to perform the fingerstick, is incorrect because asking another nurse to perform the fingerstick is unnecessary if proper training can be provided immediately. Option B, let the unlicensed assistant perform the fingerstick unsupervised, is incorrect because allowing the unlicensed assistant to perform the fingerstick unsupervised is risky without confirmation of competence per facility protocols. Option C, perform the fingerstick herself, is incorrect because performing the fingerstick herself does not address the need for unlicensed assistant training and competency verification. Here's another question to consider. This pediatric condition question on meningocele has appeared 4 times in the last 5 years in the NCLEX exam. A newborn baby is diagnosed with the neural tube defect meningocele. Which of the following definitions most accurately describes meningocele? A. A tumor of the spinal cord and accompanying nerve roots. B. Outpouching of the meninges through the cranium or vertebrae. C. Posterior laminae of the vertebrae failing to fuse. D. Spinal cord and meninges protruding through the vertebrae defect. Take a moment. Think and comment your answer below. The correct answer is B. Outpouching of the meninges through the cranium or vertebrae. Here's why. Option B, outpouching of the meninges through the cranium or vertebrae, is correct because meningocele is characterized by the protrusion of the meninges, membranes covering the brain and spinal cord, through a defect in the skull or vertebrae. It typically involves a sac-like structure filled with cerebrospinal fluid. Option A, a tumor of the spinal cord and accompanying nerve roots, is incorrect because meningocele is not a tumor, but a neural tube defect. Option C, posterior laminae of the vertebrae failing to fuse, is incorrect because this describes spina bifida occulta, a different condition. Option D, spinal cord and meninges protruding through the vertebrae defect, is incorrect because this describes myelomeningocele, a more severe form involving both the spinal cord and meninges. Let's examine another question. This medication side effect question has been asked 6 times in the last 5 years in the NCLEX exam. A 5-year-old is prescribed sulfamethoxazole trimethoprim for the treatment of otitis media. Which severe adverse reaction is most commonly associated with medications containing sulfa? A. Heart failure. B. Hives. C. Renal failure. D. Stevens-Johnson syndrome? Think it through. Comment your answer below. The correct answer is D. Stevens-Johnson syndrome. Here's why. Option D, Stevens-Johnson syndrome, is correct because Stevens-Johnson syndrome, SJS, is a severe, life-threatening hypersensitivity reaction often caused by sulfa drugs. It involves skin and mucous membrane blistering and can be fatal if not treated promptly. Option A, heart failure, is incorrect because heart failure is not typically linked to sulfa drugs. Option B, hives, is incorrect because hives are a common allergic reaction but not as severe as SJS. Option C, renal failure, is incorrect because renal failure is not a common adverse reaction associated with sulfa drugs. Next, let's look at another scenario. This continuity of care question has been featured 5 times in the last 5 years in the NCLEX exam. A child with a recent kidney transplant has requested to have the same nurse every day. Which of the following is the best response? A. It is against hospital policy to assign the same nurse to you every day. B. It is important to have a variety of nurses to ensure the best possible care. C. This will not work. We want to avoid over-involvement. D. We will try to assign the same nurse to you, but this may be difficult on some days due to staffing issues. Take a moment. Think and comment your answer below. The correct answer is D. We will try to assign the same nurse to you, but this may be difficult on some days due to staffing issues. Here's why. Option D. We will try to assign the same nurse to you, but this may be difficult on some days due to staffing issues, is correct because continuity of care promotes trust and comfort for the patient, though it must be balanced with staffing realities. Option A. It is against hospital policy to assign the same nurse to you every day, is incorrect because likely untrue and dismissive. Option B. It is important to have a variety of nurses to ensure the best possible care, is incorrect because while multiple caregivers can offer diverse perspectives, consistency is valuable, especially for a transplant patient. Option C. This will not work. We want to avoid over-involvement, is incorrect because avoiding over-involvement is not a valid reason in this context, as building a therapeutic relationship is important. Let's move on to another important question. This question on rheumatic fever diagnosis has appeared 7 times in the last 5 years in the NCLEX exam. The nurse is assessing a child suspected of having rheumatic fever in the emergency room. According to Jones criteria, which laboratory findings may indicate the presence of rheumatic fever? A. Complete blood count reveals hyponatremia and hyperkalemia. B. Chest radiography reveals pulmonary congestion and cardiomegaly. C. Electrocardiogram reveals ventricular hypertrophy. D. Erythrocyte sedimentation rate and C-reactive protein are elevated. Think it through. Comment your answer below. The correct answer is D. Erythrocyte sedimentation rate and C-reactive protein are elevated. Here's why. Option D, erythrocyte sedimentation rate and C-reactive protein are elevated, is correct because elevated erythrocyte sedimentation rate and C-reactive protein indicate inflammation and are part of the minor criteria for diagnosing rheumatic fever according to the Jones criteria. Option A, complete blood count reveals hyponatremia and hyperkalemia, is incorrect because hyponatremia and hyperkalemia are not related to rheumatic fever. Option B, chest radiography reveals pulmonary congestion and cardiomegaly, is incorrect because pulmonary congestion and cardiomegaly are signs of heart failure, not specific to rheumatic fever. Option C, electrocardiogram reveals ventricular hypertrophy, is incorrect because ventricular hypertrophy may indicate long-term cardiac changes, but not an acute indicator of rheumatic fever. Let's go over another scenario. This child safety and abuse reporting question has appeared 4 times in the last 5 years in the NCLEX exam. A 5-year-old child is admitted to the hospital with pneumonia. The nurse observes bruises on the child's back and arms. The mother is present in the patient's room. What should the nurse do next? A. Asking the mother would be accusatory and could put the child in danger if there is abuse at home. B. The nurse is a mandated reporter, and if the child confirms the suspicion or the nurse still believes that there may be abuse at home, she should make a report. But she should collect more information first. C. The nurse should always collect assessment data before calling the physician. D. Wait until the parent is not in the room and then ask the patient if they feel safe at home. Take a moment. Think and comment your answer below. The correct answer is D. Wait until the parent is not in the room and then ask the patient if they feel safe at home. Here's why. Option D. Wait until the parent is not in the room and then ask the patient if they feel safe at home is correct because asking the child about safety at home without the parent present allows for honest responses without fear of retribution. Option A. Asking the mother would be accusatory and could put the child in danger if there is abuse at home is incorrect because accusing the parent could escalate the situation and endanger the child. Option B. The nurse is a mandated reporter, and if the child confirms the suspicion or the nurse still believes that there may be abuse at home, she should make a report, but she should collect more information first. Is incorrect because while the nurse is a mandated reporter, she should gather sufficient information before reporting. Option C. The nurse should always collect assessment data before calling the physician is incorrect because immediate concern is assessing the child's safety, not medical condition. Next, let's discuss another question. This question on professional nursing behavior has appeared 6 times in the last 5 years in the NCLEX exam. The unit is understaffed, and the nurse is asked to work a double shift. What is the best way for the nurse to decline an assignment? A. Call the primary physician. B. Call the supervisor in charge. C. Inform the supervisor in charge in writing. D. Verbally refuse to accept the assignment. The correct answer is C. Inform the supervisor in charge in writing. Here's why. Option C, inform the supervisor in charge, in writing, is correct because written notification provides a formal documented refusal and is the appropriate professional response. Option A, call the primary physician, is incorrect because calling the physician is not relevant to staffing issues. Option B, call the supervisor in charge, is incorrect because verbal refusal lacks documentation and formality. Option D, verbally refuse to accept the assignment, is incorrect because calling the supervisor should be done, but written documentation is crucial. On to the next scenario. This nursing assignment question has appeared 5 times in the last 5 years in the NCLEX exam. A charge nurse on a pediatric unit has just been informed of a potential admission from the emergency department. Which of the following nurses should not be assigned to admit the patient? Select all that apply. A. A nurse caring for a child with multiple gastrointestinal bleeds. B. A nurse caring for a child with no family or visitors. C. A nurse preparing for a complex dressing change. D. A nurse caring for a patient who began receiving a blood transfusion 1 hour ago. E. A nurse who recently discharged 2 patients. The correct answers are A, B, C. Here's why. Option A, a nurse caring for a child with multiple gastrointestinal bleeds, is correct because a nurse caring for a child with multiple gastrointestinal bleeds requires frequent monitoring, making it difficult to take on a new admission. Option B, a nurse caring for a child with no family or visitors, is correct because a nurse caring for a child with no family or visitors indicates a higher need for emotional support and monitoring. Option C, a nurse preparing for a complex dressing change, is correct because a nurse preparing for a complex dressing change demands significant time and attention. Option D, a nurse caring for a patient who began receiving a blood transfusion 1 hour ago, is incorrect because a nurse caring for a patient who began receiving a blood transfusion 1 hour ago typically requires close monitoring in the first hour, after which it can be managed alongside other tasks. Option E, a nurse who recently discharged 2 patients, is incorrect because a nurse who recently discharged 2 patients is likely to have fewer current responsibilities, making this nurse available for a new admission. Let's continue to the next question. This confidentiality question has appeared 8 times in the last 5 years in the NCLEX exam. A patient with a skull fracture is unconscious, but has an advance directive and power of attorney. Some friends visit and ask the nurse about the patient's prognosis. How should the nurse respond? A. Due to confidentiality, I cannot discuss the patient's condition. B. I can't tell you, so don't ask. C. The prognosis is not good. D. You will have to ask the patient's DPOA. Think it through. Comment your answer below. The correct answer is A. Due to confidentiality, I cannot discuss the patient's condition. Here's why. Option A. Due to confidentiality, I cannot discuss the patient's condition is correct because the nurse must protect patient privacy and confidentiality according to HIPAA regulations. Sharing information without proper authorization breaches confidentiality. Option B, I can't tell you, so don't ask, is incorrect because this response is abrupt and unprofessional. Option C, the prognosis is not good, is incorrect because stating that the prognosis is not good breaches confidentiality and may be inaccurate without full context. Option D, you will have to ask the patient's DPOA, is incorrect because friends are not authorized to receive information. Confidentiality must be maintained. Let's discuss the next question. This goal-setting question has appeared 9 times in the last 5 years in the NCLEX exam. Which of the following is the best example of an appropriate patient-centered nursing goal? A. Self-administer intravenous medications. B. Eat sufficient amounts of food. C. Walk up and down the hallway. D. Before Monday, get out of bed and walk to the nurse's station and back to the bed. Think about it. Comment your answer below. The correct answer is D. Before Monday, get out of bed and walk to the nurse's station and back to the bed. Here's why. Option D. Before Monday, get out of bed and walk to the nurse's station and back to the bed is correct because the goal is specific. Get out of bed and walk to the nurse's station. Measurable, distance to the nurse's station and back. Attainable, appropriate for a patient capable of walking. Relevant, promotes mobility and recovery. And time-bound, by Monday. Option A, self-administer intravenous medications, is incorrect because self-administering intravenous medications may not be safe or appropriate for all patients. Option B, eat sufficient amounts of food, is incorrect because eating sufficient amounts of food is not specific or measurable. Option C, walk up and down the hallway, is incorrect because walking up and down the hallway is not specific or measurable without more details. On to another important question. This traction care question has appeared 4 times in the last 5 years in the NCLEX exam. While caring for an alert patient in Buck's traction, the nurse reduces friction and shear by. Select all that apply. A. Elevating the foot of the bed. B. Providing a trapeze to promote patient positioning and activity. C. Elevating the head of the bed. D. Using a positioning boot to reduce foot drop. E. Repositioning every 2 hours. Take a moment. Think and comment your answers below. The correct answers are A, B. Here's why. Option A, elevating the foot of the bed, is correct because elevating the foot of the bed helps in counter traction, reducing friction and shear forces. Option B, providing a trapeze to promote patient positioning and activity, is correct because providing a trapeze assists patients in repositioning themselves, reducing shear by facilitating independent movement. Option C, elevating the head of the bed, is incorrect because elevating the head of the bed increases shear and friction on the back and buttocks. Option D, using a positioning boot to reduce foot drop, is incorrect because using a positioning boot helps prevent foot drop but does not reduce friction and shear. Option E, repositioning every 2 hours, is incorrect because repositioning every 2 hours is important for preventing pressure ulcers, but not specific to reducing friction in Buck's traction. This medication administration question has been asked 10 times in the last 5 years in the NCLEX exam. A patient recently diagnosed with hypothyroidism is prescribed levothyroxine. The nurse should include which of the following in her teaching plan? Select all that apply. A. Do not take with antacids. B. Take at bedtime. C. Take at mealtime. D. Take early in the morning on an empty stomach. Think it through. Comment your answers below. The correct answers are A, D. Here's why. Option A, do not take with antacids, is correct because antacids can interfere with the absorption of levothyroxine. Option D, take early in the morning on an empty stomach, is correct because taking levothyroxine early in the morning on an empty stomach enhances absorption and reduces interference with sleep. Option B, take at bedtime, is incorrect because taking at bedtime can interfere with sleep and absorption. Option C, take at mealtime, is incorrect because taking at mealtime can interfere with absorption. Let's look at the next question. This confidentiality and patient rights question has appeared 3 times in the last 5 years in the NCLEX exam. A 5-year-old with HIV is planning to begin school in the fall. His parents inform the nurse that they do not plan on telling the school about their son's HIV status. Which of the following responses by the nurse is most appropriate? A. It is your right to maintain confidentiality. B. The physician is required to call the school and tell them. C. Your son will have to wear a face mask when attending school. D. You are required to inform the school. The correct answer is A. It is your right to maintain confidentiality. Here's why. Option A, it is your right to maintain confidentiality, is correct because parents and patients have the right to keep their HIV status confidential. Disclosure is not legally required in most jurisdictions. Option B, the physician is required to call the school and tell them, is incorrect because physician disclosure is not required or appropriate. Option C, your son will have to wear a face mask when attending school, is incorrect because HIV is not transmitted through casual contact, so a mask is unnecessary. Option D, you are required to inform the school, is incorrect because mandatory disclosure is not legally required. Want to take your prep to the next level? Enroll in our comprehensive NCLEX review course. You'll get access to 10,000 questions from the past 5 years, 10 mock tests, 50 hours of animated content, 1,000 hours of recorded lectures, daily 1-hour live classes at 9:00 p.m. Eastern Standard Time, and an exclusive NCLEX Prep ebook. And guess what? Enroll now and save 70%. This offer is for a limited time only, and seats are also limited. The link is in the description. Grab your spot now. Pause the video and check out this comparison chart to see why our NCLEX review course is the best compared to other course providers. Make an informed decision and choose the best. This lab value question has been asked 7 times in the NCLEX exam. Which lab value should a nurse be most concerned about in a patient taking metformin? A. Decreased hemoglobin, a 1CB urea creatinine. C. Lowered fasting blood glucose. D. Reduced glomerular filtration rate, GFR. Don't forget to write your answer in the comment box. Okay, let's see the correct answer. Correct answer is D. Reduced glomerular filtration rate, GFR. Here's why this answer is correct. Option D, reduced glomerular filtration rate, is correct because metformin is primarily excreted by the kidneys, and a decreased GFR indicates impaired renal function, which can lead to the accumulation of metformin and increase the risk of lactic acidosis. Monitoring GFR is crucial for patients on metformin to ensure their kidneys can handle the drug and to prevent serious complications. Option A, decreased hemoglobin. A1C is incorrect because a decreased hemoglobin, a 1C level, is a positive outcome of metformin therapy, reflecting improved long-term blood glucose control. Option B, urea creatinine, is incorrect because while urea and creatinine levels can indicate renal function, GFR is a more precise and direct measure of kidney function in the context of metformin therapy. Option C, lowered fasting blood glucose, is incorrect because a lowered fasting blood glucose level is a desired therapeutic effect of metformin, indicating that the medication is effectively controlling blood sugar levels. Let's move to the next question. This advice question has been asked 5 times in the NCLEX exam. To minimize the risk of Meniere's disease attacks, what advice should a nurse give a newly diagnosed patient? A. Avoid using headphones or earbuds. B. Use sterile water for ear irrigation. C. Limit salt intake in the diet. D. Speak in a monotone voice. Make sure to think about your answer before proceeding. Let's check the correct answer. Correct answer is C. Limit salt intake in the diet. Here's the rationale for this answer. Option C, limit salt intake in the diet, is correct because reducing dietary sodium intake helps to control the amount of fluid in the inner ear, thereby decreasing the pressure and reducing the frequency and severity of Meniere's disease attacks. Sodium retention can exacerbate symptoms by increasing endolymphatic fluid pressure. Option A, avoid using headphones or earbuds, is incorrect because using headphones or earbuds is not related to the fluid dynamics in the inner ear that cause Meniere's disease. In fact, hearing aids or devices can sometimes assist individuals with hearing loss due to Meniere's. Option B, use sterile water for ear
Stancoast,
irrigation, is
NCLEX coaching.
incorrect because ear irrigation with sterile water does not address the underlying issue of fluid imbalance in the inner ear and is not recommended for managing Meniere's disease. Option D, speak in a monotone voice, is incorrect because the manner of speaking has no impact on the inner ear fluid levels or the incidence of Meniere's disease attacks. The condition is not influenced by vocal habits. Now, on to the next question. This priority intervention question has been asked 6 times in the NCLEX exam. What is the priority nursing intervention for a client in skeletal traction with a pale, cold foot and an unpalpable pulse? A. Readjust the traction. B. Reassess the foot in 1 hour. C. Notify the primary healthcare provider, PHCP. D. Administer the ordered PRN acetaminophen tablet. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is C. Notify the primary healthcare provider, PHCP. Here's the reasoning behind this answer. Option C, notify the primary healthcare provider, is correct because the symptoms indicate a potential circulatory impairment, which is a medical emergency. Immediate notification of the PHCP is necessary to address and treat the underlying cause to prevent permanent damage or loss of the limb. Option A, readjust the traction, is incorrect because readjusting the traction without further assessment and orders from the PHCP could cause harm and might not address the underlying circulatory issue. Option B, reassess the foot in 1 hour, is incorrect because waiting to reassess in 1 hour delays necessary intervention, which could result in worsening of the condition and possible permanent damage. Option D, administer the ordered PRN acetaminophen tablet, is incorrect because administering pain medication does not address the circulatory impairment and may mask symptoms that need immediate medical attention. Let's continue to the next question. This post-operative intervention question has been asked 8 times in the NCLEX exam. What post-operative intervention is a priority for a client who had a left lower lobe removal for lung cancer? A. Incentive spirometer. B. Mediastinal tube. C. Closed chest drainage system. D. Tracheostomy. Think carefully and write your answer down. Now let's find out the correct answer. Correct answer is C. Closed chest drainage system. Here's why this is the correct choice. Option C, closed chest drainage system, is correct because a closed chest drainage system is crucial to manage air and fluid that can accumulate in the pleural space after surgery. This helps prevent complications such as pneumothorax or pleural effusion and promotes lung re-expansion. Option A, incentive spirometer, is incorrect because while using an incentive spirometer is important for preventing atelectasis and promoting lung expansion, it is not the immediate priority over managing pleural drainage. Option B, mediastinal tube, is incorrect because a mediastinal tube is generally used in cardiac surgeries rather than thoracic surgeries. It is not the primary intervention for lung lobe removal. Option D, tracheostomy, is incorrect because a tracheostomy is not typically required for lobe removal surgery. It is used for long-term airway management or severe airway obstruction, which is not commonly an issue in this context. Moving on to the next question. This baseline data question has been asked 4 times in the NCLEX exam. Before administering the first dose of clozapine to a client with schizophrenia, what baseline data should the nurse obtain? A. Liver function tests. B. ECG. C. Weight. D. Pulmonary function tests. Think about your answer and comment below. Here's the correct answer. Correct answer is C. Weight. Let's look at the rationale behind this answer. Option C, weight, is correct because clozapine can cause significant weight gain and metabolic disturbances, including hyperglycemia and dyslipidemia. Baseline weight is essential to monitor these potential side effects and manage them effectively over the course of treatment. Option A, liver function tests, is incorrect because while liver function tests are important for monitoring overall health, they are not the primary concern before initiating clozapine therapy, where metabolic and hematologic monitoring are prioritized. Option B, ECG, is incorrect because while an ECG can be important in monitoring cardiac side effects, it is not the most immediate baseline data needed before starting clozapine. Option D, pulmonary function tests, is incorrect because pulmonary function tests are not relevant for clozapine initiation. Clozapine does not have known significant respiratory side effects that would necessitate these tests. Let's proceed to the following question. This neglect indicator question has been asked 5 times in the NCLEX exam. What findings in a 6-year-old child might suggest neglect to a school nurse? A. Being more shy than classmates. B. Always finishing meals and being hungry later. C. Difficulty paying attention during class. D. Frequently absent from school and tired when attending. Make sure to write your answer in the comments. Okay, let's see the correct answer. Correct answer is D. Frequently absent from school and tired when attending. Here's why this answer is correct. Option D, frequently absent from school and tired when attending, is correct because frequent absences from school combined with persistent fatigue can be indicators of neglect. These symptoms may suggest that the child is not receiving adequate care or a stable home environment, necessitating further investigation by the nurse. Option A, being more shy than classmates, is incorrect because shyness can be a normal personality trait and does not alone suggest neglect. it is important to consider the child's overall behavior and context. Option B, always finishing meals and being hungry later, is incorrect because children having good appetites and feeling hungry later is typical behavior and not necessarily indicative of neglect. Option C, difficulty paying attention during class, is incorrect because difficulty paying attention is common in young children and can be due to various factors such as learning styles or classroom environment rather than neglect. Now, on to the next question. This medication clarification question has been asked 4 times in the NCLEX exam. Which medication should be clarified with the healthcare provider for a child post-tonsillectomy? A. Aspirin. B. Ibuprofen. C. Acetaminophen, APAP. D. Codeine. Think about your answer and write it down. Here's the correct answer. Correct answer is D. Codeine. Here's why this is the correct answer. Option D, codeine, is correct because codeine is contraindicated in children post-tonsillectomy due to the risk of respiratory depression. Some children rapidly metabolize codeine to morphine, leading to potentially fatal levels of the drug in their system. It is critical to avoid codeine and use safer alternatives. Option A, aspirin, is incorrect because aspirin is not recommended for children due to the risk of Reyes syndrome, making it an unsuitable choice for post-tonsillectomy pain management. Option B, ibuprofen, is incorrect because ibuprofen is a safe and effective option for pain management in children post-tonsillectomy and can be alternated with acetaminophen. Option C, acetaminophen, is incorrect because acetaminophen is a safe and effective pain reliever for children post-tonsillectomy and can be administered in an elixir form. Let's move to the next question. This emergency medication question has been asked 6 times in the NCLEX exam. In the event of a thyroid storm, which medication should the nurse seek a prescription for? A. Levothyroxine. B. Regular insulin. C. Lisinopril. D. Dexamethasone. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is D. Dexamethasone. Here's why this answer is correct. Option D, dexamethasone, is correct because dexamethasone is a corticosteroid that inhibits the conversion of T4 to T3, which is beneficial in managing a thyroid storm, a life-threatening condition characterized by severe hyperthyroidism. Dexamethasone helps reduce the effects of excessive thyroid hormones in the body. Option A, levothyroxine, is incorrect because levothyroxine is a thyroid hormone replacement used for hypothyroidism. Administering levothyroxine in a thyroid storm would worsen the condition by increasing thyroid hormone levels. Option B, regular insulin, is incorrect because regular insulin is used to treat diabetic ketoacidosis, not thyroid storm. Insulin has no role in managing the symptoms or causes of a thyroid storm. Option C, lisinopril, is incorrect because lisinopril, an ACE inhibitor, is used for hypertension and heart failure, not for managing thyroid storm. While it can reduce blood pressure, it does not address the underlying endocrine emergency. Moving on to the next question. This behavior indicator question has been asked 4 times in the NCLEX exam. What behaviors might suggest that a client with advanced dementia is experiencing pain? A. Rubbing a body part. B. Wandering. C. Unlabored respirations. D. Inexpressive facial expression. Make sure to write your answer in the comments. Okay, let's see the correct answer. Correct answer is A. Rubbing a body part. Here's why this answer is correct. Option A, rubbing a body part, is correct because rubbing a body part is a common behavior indicating pain in clients with dementia who may not be able to verbally communicate their discomfort. Other signs include vocalizations, facial grimacing, bracing, and restlessness. Option B, wandering, is incorrect because wandering is a common behavior in advanced dementia but does not specifically indicate pain. It may be due to confusion or a need for movement rather than discomfort. Option C, unlabored respirations, is incorrect because unlabored respirations are not associated with pain. Pain often causes labored or rapid breathing, not calm and steady respirations. Option D, inexpressive facial expression, is incorrect because an inexpressive facial expression does not indicate pain. Pain-related facial expressions typically include grimacing or frowning. Now, on to the next question. This assessment finding question has been asked 3 times in the NCLEX exam. What assessment finding supports a diagnosis of age-related cataracts? A. Difficulty seeing at night, especially while driving. B. Peripheral vision loss. C. Central vision loss. D. Blurred vision with headache. Make sure to think about your answer before proceeding. Let's check the correct answer. Correct answer is A. Difficulty seeing at night, especially while driving. Here's why. This answer is correct. Option A, difficulty seeing at night, especially while driving, is correct because age-related cataracts often cause difficulty with night vision, particularly while driving, due to the clouding of the lens, which scatters light and creates glare. This symptom is a hallmark of cataracts, affecting the clarity of vision in low-light conditions. Option B, peripheral vision loss, is incorrect because peripheral vision loss is more characteristic of glaucoma, where increased intraocular pressure damages the optic nerve. Option C, central vision loss, is incorrect because central vision loss is associated with macular degeneration, not cataracts. Macular degeneration affects the central part of the retina, leading to a loss of central vision. Option D, blurred vision with headache, is incorrect because while cataracts cause blurred vision, they are typically painless. Headaches are not a common symptom directly caused by cataracts. Now, on to the next question. This emergency medication question has been asked 8 times in the NCLEX exam. In an emergency situation where a patient has ingested an excessive amount of lorazepam, what medication is expected to be administered to counteract the overdose? A. Epinephrine. B. Naloxone. C. Acetaminophen. D. Flumazenil. Write your answer down before checking. Let's see the correct answer. Correct answer is D. Flumazenil. Here's why this answer is correct. Option D, flumazenil, is correct because it is a benzodiazepine receptor antagonist specifically used to reverse the sedative effects of benzodiazepines like lorazepam. It effectively counters the central nervous system depression caused by the overdose. Option A, epinephrine, is incorrect because epinephrine is used in cases of severe allergic reactions and anaphylaxis, not for benzodiazepine overdoses. Option B, naloxone, is incorrect because naloxone is an opioid antagonist used to reverse opioid overdoses, not benzodiazepines like lorazepam. Option C, acetaminophen, is incorrect because acetaminophen is a pain reliever and antipyretic, not an antidote for benzodiazepine overdoses. Transform your NCLEX prep with our premier review course. Enroll now to access 10,000 questions, 10 mock tests, 50 hours of animated content, 1,000 hours of recorded lectures, daily 1-hour live classes at 9 o'clock p.m. Eastern Standard Time, and a detailed NCLEX prep ebook. And the best news, enroll now and save 70%. This offer won't last long, and seats are limited. Check the description for the link and register now. Pause the video to view our comparison chart and discover why our NCLEX review course surpasses other providers. Make the best choice for your future and enroll today. Let's move to the next question. This preparatory step question has been asked 5 times in the NCLEX exam. Before starting chest physiotherapy for a child with cystic fibrosis, which preparatory step should the nurse take? A. Instruct the child to use the incentive spirometer. B. Provide supplemental oxygen via nasal cannula. C. Administer the prescribed albuterol. D. Attach continuous pulse oximetry. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is C. Administer the prescribed albuterol. Here's why this answer is correct. Option C, administer the prescribed albuterol, is correct because administering a bronchodilator like albuterol before CPT helps open the airways, making it easier to clear mucus from the lungs. This step is essential for maximizing the effectiveness of the therapy. Option A, instruct the child to use the incentive spirometer, is incorrect because while an incentive spirometer is useful for lung expansion, it is not required before CPT. Option B, provide supplemental oxygen, is incorrect because routine supplemental oxygen is not necessary unless the child has demonstrated a need for it. Option D, attach continuous pulse oximetry, is incorrect because continuous pulse oximetry is not necessary unless there is a specific concern about the child's oxygen levels during CPT. Moving on to the next question. This stage of grief question has been asked 7 times in the NCLEX exam. A terminally ill client expresses a wish to live 2 more months to attend a significant family event. Which stage of grief does this statement represent? A. Depression. B. Bargaining. C. Anger. D. Denial. Remember to think about your answer and write it down. Here's the correct answer. Correct answer is B. Bargaining. Here's why. This answer is correct. Option B, bargaining, is correct because bargaining is a stage of grief where individuals attempt to negotiate for more time or a delay in the inevitable, often making deals or promises in exchange for more time. Option A, depression, is incorrect because depression is marked by profound sadness and despair, not attempts to negotiate more time. Option C, anger, is incorrect because anger involves frustration and rage rather than negotiations or requests for more time. Option D, denial, is incorrect because denial involves refusal to accept the reality of the situation, which is not demonstrated in this statement. Let's continue to the next question. This monitoring parameter question has been asked 6 times in the NCLEX exam. For a client with diabetes insipidus receiving vasopressin therapy, which parameters should the nurse monitor to assess the medication's effectiveness? A. Heart rate. B. Urine output. C. Blood glucose levels. D. Serum sodium levels. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is B. Urine output. Here's why this answer is correct. Option B, urine output, is correct because vasopressin is used to reduce urine output in diabetes insipidus by promoting water reabsorption in the kidneys. Monitoring urine output is the most direct way to assess the medication's effectiveness. Option A, heart rate, is incorrect because heart rate is not the primary parameter to assess in evaluating the effectiveness of vasopressin for diabetes insipidus. Option C, blood glucose levels, is incorrect because blood glucose levels are not directly impacted by vasopressin in the context of diabetes insipidus. Option D, serum sodium levels, is incorrect because although serum sodium levels are important, they are not the primary indicator of vasopressin's immediate effectiveness. Now, on to the next question. This exercise recommendation question has been asked 5 times in the NCLEX exam. A pregnant client in her 3rd trimester wants to begin exercising. Which activity should the nurse recommend? A. High-intensity interval training. B. Swimming. C. Aerial yoga. D. Cycling. You could win $1,000 by giving correct answers to all 150 questions. Think about your answer and write it down. Here's the correct answer. Correct answer is B. Swimming. Here's why this answer is correct. Option B, swimming, is correct because swimming is a low-impact exercise that supports the body and reduces stress on the joints. It is safe and beneficial for pregnant women, particularly in the later stages of pregnancy. Option A, high intensity interval training, is incorrect because high intensity interval training is too strenuous for someone starting a new exercise routine late in pregnancy. Option C, aerial yoga, is incorrect because aerial yoga involves significant balance and strength, which may not be safe or appropriate during pregnancy. Option D, cycling, is incorrect because cycling can be risky due to balance issues and the potential for falls. Let's move to the next question. This delegation question has been asked 9 times in the NCLEX exam. When assigning clients to a licensed practical nurse, LPN, which patient would be appropriate to delegate? A, a client 2 hours post total laryngectomy. B, a client awaiting a referral for diabetes management education. C, a client with Guillain-Barré syndrome, experiencing breathing difficulties. D, a client with severe pressure ulcers on the sacral area. Write your answer in the comment box. Now, let's see the correct answer. Correct answer is D, a client with severe pressure ulcers on the sacral area. Here's the rationale. Option D, a client with severe pressure. Ulcers on the sacral area is correct because managing pressure ulcers, including dressing changes and wound care, falls within the LPN-VN's scope of practice. Option A, a client 2 hours post total laryngectomy, is incorrect because a client post total laryngectomy requires immediate post-operative care and monitoring, which should be managed by an RN. Option B, a client awaiting a referral for diabetes management education, is incorrect because arranging referrals and providing initial education for diabetes management typically falls under the RN's responsibilities. Option C, a client with Guillain-Barré syndrome. Experiencing breathing difficulties is incorrect because a client with Guillain-Barré syndrome and breathing difficulties requires close monitoring and possible intervention that should be managed by an RN. Let's move to the next question. This monitoring parameter question has been asked 7 times in the NCLEX exam. For a client receiving nitroglycerin therapy, what is the most critical parameter to monitor? A, respiratory rate. B, heart sounds. C, blood pressure. D, blood sugar. Think about your answer and comment below. Here's the correct answer. Correct answer is C, blood pressure. Here's the rationale. Option C, blood pressure, is correct because nitroglycerin can cause significant vasodilation and hypotension. Close monitoring of blood pressure is essential to prevent adverse effects, such as fainting or shock. Option A, respiratory rate, is incorrect because respiratory rate is not the primary concern with nitroglycerin administration. Option B, heart sounds, is incorrect because heart sounds are not directly impacted by nitroglycerin. Option D, blood sugar, is incorrect because blood sugar levels are not directly impacted by nitroglycerin therapy. Now, on to the next question. This age-appropriate care question has been asked 6 times in the NCLEX exam. When providing age-appropriate care to a preschooler, which statement by a new nurse indicates understanding? A, competitive games can make the preschooler more cooperative. B, we need to ensure the preschooler doesn't feel threatened by explaining procedures simply and checking their understanding. C, we can gain the preschooler's cooperation by thoroughly explaining procedures. D, the preschooler should never have to wait to have their needs met. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is B. We need to ensure the preschooler doesn't feel threatened by explaining procedures simply and checking their understanding. Here's why this answer is correct. Option B, we need to ensure the preschooler doesn't feel threatened by explaining procedures simply and checking their understanding, is correct because preschoolers benefit from simple, clear explanations to reduce fear and anxiety. Ensuring they understand what will happen helps them feel more secure and cooperative. Option A, competitive games can make the preschooler more cooperative, is incorrect because competitive games are not typically effective in making preschoolers cooperative in a healthcare setting. Option C, we can gain the preschooler's cooperation by thoroughly explaining procedures, is incorrect because thorough explanations can overwhelm a preschooler who needs concise and straightforward information. Option D, the preschooler should never have to wait to have their needs met, is incorrect. Because while it is important to meet a child's needs, preschoolers can learn to handle some degree of delayed gratification. Let's continue to the next question. This management of placenta previa question has been asked 5 times in the NCLEX exam. In managing a client at 39 weeks gestation with placenta previa, which standard procedures should be avoided to prevent complications? A. Positioning on the left side. B. Abdominal palpation. C. Cervical examination. D. Ultrasound examination. You could win $1,000 by giving correct answers to all 150 questions. Think about your answer and write it down. Here's the correct answer. Correct answer is C. Cervical examination. Here's why this answer is correct. Option C, cervical examination, is correct because performing a cervical examination in a client with placenta previa can trigger severe bleeding and preterm labor. The placenta's placement over or near the cervix makes it vulnerable to trauma from manual examination. Option A, positioning on the left side, is incorrect because positioning on the left side is beneficial for improving circulation and is safe for clients with placenta previa. Option B, abdominal palpation, is incorrect because abdominal palpation can be performed carefully without direct impact on the cervix. Option D, ultrasound examination, is incorrect because ultrasound is safe and helps monitor the placenta's position. Moving on to the next question. This cultural competence question has been asked 6 times in the NCLEX exam. In planning a culturally competent care education program, which population is known for preferring cremation over burial of the deceased? A. Mormonism. B. Islam. C. Eastern Orthodox. D. Hinduism. Make sure to write your answer in the comments. Okay, let's see the correct answer. Correct answer is D. Hinduism. Here's why this answer is correct. Option D, Hinduism, is correct because in Hindu culture, cremation is the traditional practice for handling deceased remains. It is believed to help the soul in its journey to the next life. Option A, Mormonism, is incorrect because Mormonism generally prefers burial practices. Option B, Islam, is incorrect because Islam typically prescribes burial over cremation. Option C, Eastern Orthodox, is incorrect because the Eastern Orthodox Church traditionally favors burial over cremation. Let's move to the next question. This dietary advice question has been asked 5 times in the NCLEX exam. During the discharge process for a client who was treated for digoxin toxicity, what dietary advice should the nurse emphasize to prevent future toxicity? A. Sodium. B. Chloride. C. Potassium. D. Calcium. Think carefully and write your answer down. Now let's find out the correct answer. Correct answer is C. Potassium. Here's why this answer is correct. Option C, potassium, is correct because hypokalemia, low potassium levels, significantly increases the risk of digoxin toxicity. It is crucial for the client to maintain adequate potassium intake to prevent this condition. Foods such as bananas, oranges, spinach, and sweet potatoes are high in potassium and should be included in the diet. Option A, sodium, is incorrect because sodium intake is more relevant for conditions like hypertension and heart failure, but it does not have a direct impact on digoxin toxicity. Option B, chloride, is incorrect because chloride levels do not have a direct impact on digoxin toxicity, and dietary management of chloride is not necessary for preventing this condition. Option D, calcium, is incorrect because calcium levels are not related to digoxin toxicity, and dietary calcium does not need to be specifically monitored in this context. Now, on to
Stancoast,
the next
NCLEX
question.
coaching.
This medication discontinuation question has been asked 4 times in the NCLEX exam. Before undergoing a CT scan with iodine-based contrast, which medication should be temporarily stopped to avoid adverse interactions? A. Enalapril. B. Levodopa. C. Metformin. D. Metoclopramide. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is C. Metformin. Here's why this answer is correct. Option C, metformin, is correct because metformin can increase the risk of lactic acidosis when used with iodine-based contrast. It should be discontinued 24 hours before the procedure and resumed 48 hours after, pending normal kidney function tests. Option A, enalapril, is incorrect because enalapril is a blood pressure medication that does not interact with iodine-based contrast dye. Option B, levodopa, is incorrect because levodopa, used for Parkinson's disease, does not have known interactions with iodine-based contrast. Option D, metoclopramide, is incorrect because metoclopramide, an antiemetic, is safe to use with iodine-based contrast. Let's continue to the next question. This PICC line care question has been asked 6 times in the NCLEX exam. For a client with a double lumen peripherally inserted central catheter, PICC, which action should the nurse take to ensure proper care? A. Flush heparin prior to discontinuation. B. Change the dressing daily using sterile technique. C. Aspirate each lumen for blood return and then flush. D. Assign the client to a private room. Make sure to think about your answer before proceeding. Let's check the correct answer. Correct answer is C. Aspirate each lumen for blood return and then flush. Here's why this answer is correct. Option C, aspirate each lumen for blood return and then flush, is correct because checking for blood return before flushing each lumen ensures the PICC line is patent and helps prevent occlusion. Flushing maintains the line's integrity. Option A, flush heparin prior to discontinuation, is incorrect because heparin is typically used to maintain catheter patency, but it is not necessary to flush with heparin before discontinuing a PICC line. Option B, change the dressing daily using sterile technique, is incorrect because PICC line dressings should be changed every 7 days or sooner if they become soiled or damp, not daily. Option D, assign the client to a private room, is incorrect because a private room is not required solely for a central line unless the client has an infectious condition that necessitates isolation. Let's move to the next question. This post-procedure care question has been asked 5 times in the NCLEX exam. What post-procedure care should the nurse include when educating a client scheduled for a percutaneous kidney biopsy? A. Before you eat, your gag reflex will need to return. B. A heating pad will be applied to the affected area for pain relief. C. You will need to lie flat immediately after this procedure. D. You can resume your regular activities and diet right after the procedure. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is C. You will need to lie flat immediately after this procedure. Here's why this answer is correct. Option C, you will need to lie flat immediately after this procedure, is correct because lying flat helps reduce the risk of bleeding by applying pressure to the biopsy site and promoting hemostasis. Option A, before you eat, your gag reflex will need to return, is incorrect because the gag reflex is not relevant to a kidney biopsy as it is not performed under general anesthesia. Option B, a heating pad will be applied to the affected area for pain relief, is incorrect because applying heat can increase bleeding risk through vasodilation and should be avoided. Option D, you can resume your regular activities and diet right after the procedure, is incorrect because clients need to rest and avoid strenuous activities post-biopsy to prevent complications such as bleeding. Now, on to the next question. This prioritization question has been asked 7 times in the NCLEX exam. In prioritizing client care, which client should the nurse attend to first? A. A client with acute pancreatitis reporting nausea and pain rated 5 out of 10. B. A client with pneumonia and atelectasis with decreased breath sounds in the affected lobe. C. A client with a chest tube reporting increased dyspnea and dizziness. D. A client with pheochromocytoma reporting a headache with a blood pressure of 146 over 82 millimeters of mercury. Make sure to think about your answer and write it down. Here's the correct answer. Correct answer is C. A client with a chest tube reporting increased dyspnea and dizziness. Here's why this answer is correct. Option C. A client with a chest tube reporting increased dyspnea and dizziness is correct because increased dyspnea and dizziness in a client with a chest tube may indicate a tension pneumothorax, which is a life-threatening emergency requiring immediate intervention. Option A. A client with acute pancreatitis reporting nausea and pain rated 5 out of 10 is incorrect because while pain management is important, it is not as urgent as the potential respiratory distress indicated in option C. Option B. A client with pneumonia and atelectasis with decreased breath sounds in the affected lobe is incorrect because decreased breath sounds in pneumonia and atelectasis are expected findings and do not indicate an immediate emergency. Option D. A client with pheochromocytoma reporting a headache with a blood pressure of 146 over 82 millimeters of mercury is incorrect because although pheochromocytoma can cause serious symptoms, the blood pressure reading provided is not critically high, and the headache, while concerning, does not indicate an immediate life-threatening situation. Let's move to the next question. This observation and follow-up question has been asked 4 times in the NCLEX exam. During orientation, a preceptor observes a new nurse performing various tasks. Which action would require follow-up by the preceptor? A. Securing a suprapubic catheter tubing to a client's inner thigh. B. Placing a client with varicella zoster in airborne and contact isolation. C. Humidifying nasal cannula oxygen for a client with sarcoidosis. D. Suctioning a tracheostomy for 10 seconds as they remove the catheter. Write your answer down before checking. Let's see the correct answer. Correct answer is A. Securing a suprapubic catheter tubing to a client's inner thigh. Here's why this answer is correct. Option A, securing a suprapubic catheter tubing to a client's inner thigh, is correct because securing a suprapubic catheter to the inner thigh can cause tension and discomfort. It should be secured to the abdomen to prevent pulling and reduce the risk of dislodgement. Option B, placing a client with varicella zoster in airborne and contact isolation, is incorrect because airborne and contact isolation are appropriate for varicella. Away zoster to prevent transmission. Option C, humidifying nasal cannula oxygen for a client with sarcoidosis, is incorrect because humidifying oxygen is appropriate to prevent drying of mucous membranes, especially for higher flow rates. Option D, suctioning a tracheostomy for 10 seconds as they remove the catheter, is incorrect because suctioning a tracheostomy for 10 seconds or less is correct to avoid hypoxia and trauma to the tracheal mucosa. Now on to the next question. This pulmonary edema question has been asked 5 times in the NCLEX exam. After a non-fatal drowning incident, a client is now experiencing pulmonary edema. What is the underlying cause of this condition? A. A sudden change in temperature within the lungs. B. Decreased intrathoracic pressure in the lungs. C. Water, introducing bacteria into the lungs and causing infection. D. Water, washing out the alveolar surfactant. Don't forget to write your answer in the comments. Okay, let's see the correct answer. Correct answer is D. Water, washing out the alveolar surfactant. Here's why this answer is correct. Option D, water washing out the alveolar surfactant, is correct because water aspiration can wash out the surfactant in the alveoli, leading to increased surface tension, alveolar collapse, and subsequent pulmonary edema. Option A sudden change in temperature within the lungs, is incorrect because a sudden change in temperature does not cause pulmonary edema. Option B, decreased intrathoracic pressure in the lungs, is incorrect because decreased intrathoracic pressure is not a cause of pulmonary edema. Option C, water introducing bacteria into the lungs and causing infection, is incorrect because bacterial infection from water does not directly cause pulmonary edema. It can lead to pneumonia. Now, on to the next question. This PICC line care question has been asked 4 times in the NCLEX exam. When caring for a client with a peripherally inserted central catheter, PICC, what indicates proper nursing care? A. Slowly flushing each lumen with 0.9% sodium chloride using a 10 ml syringe. B. Flushing each lumen with 0.9% sodium chloride using a 5 ml syringe. C. Using a pulsatile flush technique with 0.9% sodium chloride in a 10 ml syringe. D. Flushing each lumen with sterile water
Stancoast
using a
NCLEX
10
coaching.
ml syringe. Write your answer down before checking. Let's see the correct answer. Correct answer is C. Using a pulsatile flush technique with 0.9% sodium chloride in a 10 ml syringe. Here's why this answer is correct. Option C, using a pulsatile flush technique with 0.9% sodium chloride in a 10 ml syringe, is correct because the pulsatile flush technique helps clear the catheter of debris and maintains patency. Using a 10 ml syringe provides the appropriate pressure and volume for flushing. Option A, slowly flushing each lumen with 0.9% sodium chloride using a 10 ml syringe, is incorrect because while the volume is correct, the flush should be pulsatile, not slow and continuous. Option B, flushing each lumen with 0.9% sodium chloride using a 5 ml syringe, is incorrect because a 5 ml syringe does not provide adequate pressure for flushing a PICC line. Option D, flushing each lumen with sterile water using a 10 ml syringe, is incorrect because sterile water is not recommended for flushing central lines due to its hypotonicity. Let's move to the next question. This GERD intervention question has been asked 6 times in the NCLEX exam. What intervention can help alleviate symptoms of gastroesophageal reflux disease, GERD? A. Lie down immediately after eating. B. Wear tight-fitting clothes. C. Increase fluid intake before bedtime. D. Elevate the head of the bed by 6 inches. You could win $1,000 by giving correct answers to all 150 questions. Think about your answer and write it down. Here's the correct answer. Correct answer is D. Elevate the head of the bed by 6 inches. Here's why this answer is correct. Option D, elevate the head of the bed by 6 inches, is correct because elevating the head of the bed reduces acid reflux by keeping stomach contents in the stomach and preventing them from moving back into the esophagus. Option A, lie down immediately after eating, is incorrect because lying down after eating can worsen GERD symptoms by allowing stomach acid to flow back into the esophagus. Option B, wear tight-fitting clothes, is incorrect because tight-fitting clothes can increase pressure on the abdomen and worsen GERD symptoms. Option C, increase fluid intake before bedtime, is incorrect because increasing fluid intake before bedtime can increase the likelihood of reflux during sleep. Let's move to the next question. This management style question has been asked 5 times in the NCLEX exam. A nurse manager implements immediate changes in medication administration procedures after a medication error is investigated. What management style does this exemplify? A. Democratic. B. Autocratic. C. Passive aggressive. D. Laissez faire. Write your answer down before checking. Let's see the correct answer. Correct answer is B. Autocratic. Here's why this answer is correct. Option B, autocratic, is correct because an autocratic management style involves making decisions without consulting staff, as seen when the nurse manager unilaterally implements changes. Option A, democratic, is incorrect because a democratic management style involves seeking input from staff before making decisions. Option C, passive aggressive, is incorrect because passive aggressive is not a recognized management style and does not apply to the scenario. Option D, laissez faire, is incorrect because a laissez faire management style involves minimal direction and decision making by the manager, often allowing staff to make decisions independently. Let's move to the next question. This question has been asked 7 times in the NCLEX exam. For a pregnant client at 28 weeks gestation showing signs of preeclampsia, what potential complication should the nurse monitor for when administering magnesium sulfate? A. Hyperreflexia. B. Increased fetal movement. C. Hyperglycemia. D. Pulmonary edema. Don't forget to write your answer in the comment box. Okay, let's see the correct answer. Correct answer is A. Hyperreflexia. Here's the rationale. Option A, hyperreflexia, is correct because hyperreflexia or airflexia is a sign of magnesium toxicity, indicating that the magnesium sulfate levels may be too high. It can precede respiratory depression and cardiac arrest. Option B, increased fetal movement, is incorrect because magnesium sulfate tends to have a sedative effect, potentially reducing fetal movement rather than increasing it. Option C, hyperglycemia, is incorrect because hyperglycemia is not associated with magnesium sulfate. Option D, pulmonary edema, is incorrect because while pulmonary edema is a concern in preeclampsia, it is not a direct complication of magnesium sulfate administration. Let's move to the next question. This application technique question has been asked 6 times in the NCLEX exam. When applying prescribed nitroglycerin ointment, what should the nurse do to ensure proper administration? A. Use a gauze dressing to cover the ointment. B. Apply it exclusively to the client's upper chest. C. Change the application site each time. D. Massage the ointment into the skin until fully absorbed. Write your answer in the comment box. Now, let's see the correct answer. Correct answer is C. Change the application site each time. Here's the rationale. Option C, change the application site each time, is correct because rotating the application sites helps prevent skin irritation and tachyphylaxis, which can occur if the medication is applied to the same area repeatedly. This practice also ensures consistent absorption of the medication. Option A, use a gauze dressing to cover the ointment, is incorrect because covering the ointment with a gauze dressing is not necessary. The special applicator paper provided with the ointment should be used to apply the correct dose, and the area should be left uncovered to allow for proper absorption. Option B, apply it exclusively to the client's upper chest, is incorrect because nitroglycerin ointment can be applied to any clean, dry, and hairless part of the body, not just the chest. The upper arms, back, and abdomen are also suitable areas for application. Option D, massage the ointment into the skin until fully absorbed, is incorrect because rubbing the ointment into the skin can lead to rapid absorption and a sudden drop in blood pressure, which can cause severe hypotension. The ointment should be applied as a thin layer and covered with a special applicator paper. Let's continue to the next question. This prenatal client question has been asked 4 times in the NCLEX exam. A prenatal client at 8 weeks has a hematocrit of 35% and hemoglobin of 11 grams per deciliter, which are lower than pre-pregnancy levels. What should the nurse do? A. Document the findings and check if the client is on prenatal vitamins at the next visit. B. Ask the client to return for a repeat blood test. C. Notify the lab for reassessment as the results appear abnormal. D. Immediately report these levels to the primary healthcare provider. Think about your answer and comment below. Here's the correct answer. Correct answer is A. Document the findings and check if the client is on prenatal vitamins at the next visit. Here's the rationale. Option A, document the findings and check if the client is on prenatal vitamins at the next visit, is correct because a slight decrease in hemoglobin and hematocrit levels during pregnancy is common due to increased plasma volume, known as physiological anemia. It is important to confirm that the client is taking prenatal vitamins, which typically contain iron and folic acid to support increased blood volume and prevent anemia. Option B, ask the client to return for a repeat blood test, is incorrect because repeating the blood test is unnecessary if the levels are within expected ranges for pregnancy. This would cause unnecessary stress for the client. Option C, notify the LAB for reassessment as the results appear abnormal, is incorrect because the results are typical for a pregnant client, and no reassessment by the LAB is needed. These values do not indicate an abnormal condition. Option D, immediately report these levels to the primary healthcare provider, is incorrect because the levels are within the normal range for pregnancy and do not require immediate reporting to the primary healthcare provider. Let's move to the next question. This Alzheimer's care question has been asked 7 times in the NCLEX exam. When caring for a client with Alzheimer's disease, what should be the nurse's primary concern? A. Family coping challenges. B. Risk of injury. C. Difficulty performing activities of daily living. D. Potential for constipation. Write your answer in the comment box. Okay, let's see the correct answer. Correct answer is B. Risk of injury. Here's the rationale. Option B, risk of injury, is correct because clients with Alzheimer's disease are at a high risk for injury due to their impaired cognitive function, which can lead to wandering, falls, and accidents. Ensuring a safe environment is crucial to prevent harm. Option A, family coping challenges, is incorrect because while family coping is important, the primary focus should be on the client's safety to prevent potential injuries. Option C, difficulty performing activities of daily living, is incorrect because while difficulty with activities of daily living is significant, it does not pose an immediate threat to the client's safety like the risk of injury does. Option D,
Stancoast NCLEX
potential for
coaching.
constipation, is incorrect because although constipation is a concern, it is not as urgent as ensuring the client's immediate physical safety. Let's move to the next question. This HPV vaccine question has been asked 5 times in the NCLEX exam. The nurse is educating a client about the human papillomavirus, HPV vaccine. Which group is primarily targeted for this vaccination? A. Pregnant women. B. Infants at 8 months of age. C. Adults 60 years and older. D. Children ages 11-12 years. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is D. Children ages 11-12 years. Here's why this answer is correct. Option D, children. Ages 11-12 years is correct because the HPV vaccine is recommended for children around the ages of 11-12 years, ideally before they become sexually active. The vaccine protects against the HPV virus, which can cause genital warts and several types of cancer, including cervical cancer. Option A, pregnant women, is incorrect because the HPV vaccine is contraindicated for pregnant women due to insufficient data on its safety in this population. Option B, infants at 8 months of age, is incorrect because the HPV vaccine is not administered to infants. It is intended for preteens and teenagers before they become sexually active. Option C, adults 60 years and older, is incorrect because the vaccine is not typically given to older adults, as they are less likely to benefit from it after potential exposure to HPV. Let's continue to the next question. This iron deficiency anemia question has been asked 6 times in the NCLEX exam. A parent is administering ferrous sulfate elixir to a 10-year-old with iron deficiency anemia. What instruction should the nurse give? A. Have the child remain upright for 30 minutes after taking it. B. Dilute the medication in water or juice. C. Give the medication with food. D. Take the medication with calcium-rich foods. Make sure to write your answer in the comments. Okay, let's see the correct answer. Correct answer is B. Dilute the medication in water or juice. Here's the rationale. Option B, dilute the medication in water or juice, is correct because diluting ferrous sulfate elixir in water or juice helps prevent staining of the teeth. Additionally, using a straw to drink the diluted solution can further reduce the risk of tooth discoloration. Rinsing the mouth afterward is also recommended. Option A, have the child remain upright for 30 minutes after taking it, is incorrect because there is no need to remain upright after taking ferrous sulfate, unlike some medications that can cause esophagitis. Option C, give the medication with food, is incorrect because ferrous sulfate should ideally be taken on an empty stomach to enhance absorption. However, if gastrointestinal upset occurs, it can be taken with a small amount of food. Option D, take the medication with calcium-rich foods, is incorrect because calcium can inhibit the absorption of iron. Therefore, ferrous sulfate should not be taken with calcium-rich foods or milk products. Now, on to the next question. This reminiscence therapy question has been asked 5 times in the NCLEX. A 78-year-old man at an adult daycare center frequently shares stories about his past, including traveling on orphan trains. How should the nurse respond? A. Engage him in more social activities. B. Suggest a psychiatric evaluation. C. Listen and ask questions about his life. D. Redirect the conversation to other topics. Think about your answer and write it down. Here's the correct answer. Correct answer is C. Listen and ask questions about his life. Here's why this answer is correct. Option C, listen and ask questions about his life, is correct because listening and engaging with the client's stories demonstrates respect and interest, which can boost his self-esteem and promote a sense of identity and value. Reminiscence therapy is beneficial for older adults as it helps them reflect on their past experiences, achievements, and contributions to society. Option A, engage him in more social activities, is incorrect because while social activities are beneficial, they should not replace the therapeutic value of reminiscence and personal storytelling. Option B, suggest a psychiatric evaluation, is incorrect because sharing life stories is a normal part of aging and does not indicate a need for psychiatric evaluation unless accompanied by other concerning behaviors or symptoms. Option D, redirect the conversation to other topics, is incorrect because redirecting the conversation can be dismissive and may diminish the importance of his life experiences. Let's move to the next question. This hypokalemia management question has been asked 4 times in the NCLEX exam. A client with hypokalemia is scheduled to receive 40 milliequivalents of intravenous potassium to be given over the next 5 hours by infusion. Which condition requires the nurse to notify the primary healthcare provider, PHCP, before administration? A. Weak peripheral pulses. B. Abdominal distension. C. Muscle weakness. D. Oliguria. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is D. Oliguria. Here's the rationale. Option D, oliguria, is correct because oliguria, or reduced urine output, can indicate renal impairment. Administering IV potassium in such cases can lead to dangerous hyperkalemia since the kidneys may not excrete the potassium efficiently. It is crucial to ensure adequate renal function before administering potassium. Option A, weak peripheral pulses, is incorrect because weak peripheral pulses, though concerning, do not specifically contraindicate potassium administration if hypokalemia is present and renal function is adequate. Option B, abdominal distension, is incorrect because while abdominal distension can be related to various gastrointestinal issues, it does not directly contraindicate IV potassium administration. Option C, muscle weakness, is incorrect because muscle weakness is a common symptom of hypokalemia and indicates the need for potassium supplementation rather than withholding it. Now, on to the next question. This mental health assessment question has been asked 5 times in the NCLEX exam. Which client in a mental health unit should the nurse assess first? A, a client with OCD who has increased hand washing. B, a client with psychosis pacing and mumbling in the hallway. C, a client with substance use disorder refusing group therapy. D, a client with borderline personality disorder alleging abuse 2 days ago. Make sure to think about your answer and write it down. Here's the correct answer. Correct answer is B, a client with psychosis pacing and mumbling in the hallway. Here's why this answer is correct. Option B, a client with psychosis pacing and mumbling in the hallway, is correct because pacing and mumbling can indicate agitation or potential aggression, which requires immediate intervention to prevent harm to the client or others. Addressing these behaviors promptly can de-escalate the situation and ensure a safer environment. Option A, a client with OCD who has increased hand washing, is incorrect because increased hand washing in a client with OCD is a coping mechanism for anxiety and does not pose an immediate risk to the client or others. Option C, a client with substance use disorder refusing group therapy, is incorrect because refusing group therapy indicates non-compliance with the treatment plan but does not pose an immediate danger. Option D, a client with borderline personality disorder alleging abuse 2 days ago, is incorrect because while the abuse allegation needs follow-up, it occurred 2 days ago and does not present an immediate threat requiring urgent intervention. Let's move to the next question. This tuberculosis medication question has been asked 6 times in the NCLEX exam. What should the nurse teach a client taking isoniazid, ANH, for tuberculosis? A, take a B-complex vitamin to help prevent neuropathy. B, this medication may turn your secretions reddish-orange. C, you need to take this medication daily for at least 1 week. D, yellowing of your eyes is a normal side effect. Write your answer in the comment box. Okay, let's see the correct answer. Correct answer is A, take a B-complex vitamin to help prevent neuropathy. Here's the rationale. Option A, take a B-complex vitamin to help prevent neuropathy, is correct because INH can deplete vitamin B6, pyridoxine, leading to peripheral neuropathy. Taking a B-complex vitamin helps prevent this side effect by replenishing the body's vitamin B6 stores. Option B, this medication may turn your secretions reddish-orange, is incorrect because reddish-orange secretions are a side effect of rifampin, not INH. Option C, you need to take this medication daily for at least 1 week, is incorrect because tuberculosis treatment with INH requires long-term therapy, typically at least 6 months, to ensure complete eradication of the infection. Option D, yellowing of your eyes is a normal side effect, is incorrect because yellowing of the eyes, jaundice, indicates hepatotoxicity, a serious side effect that should be reported immediately, not considered normal. Let's move to the next question. This tracheostomy care question has been asked 5 times in the NCLEX exam. A nurse is caring for a patient with a newly inserted tracheostomy. Which of the following actions should the nurse take first? A. Suction the tracheostomy tube. B. Secure the tracheostomy ties. C. Assess the respiratory status. D. Apply a sterile dressing around the stoma. Don't forget to comment your answer. Let's reveal the correct one. Correct answer is C. Assess the respiratory status. Here's why this answer is correct. Option C, assess the respiratory status, is correct because assessing the respiratory status is the first priority to ensure that the patient is breathing effectively and there are no immediate complications with the tracheostomy. Option A, suction the tracheostomy tube, is incorrect because suctioning the tracheostomy tube should be performed if the patient shows signs of respiratory distress or obstruction, but initial assessment takes precedence. Option B, secure the tracheostomy ties, is incorrect because securing the tracheostomy ties is important to prevent dislodgement, but it should follow the assessment of respiratory status. Option D, apply a sterile dressing around the stoma, is incorrect because applying a sterile dressing around the stoma is necessary to prevent infection, but it is not the first priority. Now, on to the next question. This prioritization question has been asked 6 times in the NCLEX exam. Which prescription should the nurse administer first for newly admitted clients? A. Metoprolol to a client with essential hypertension. B. Levodopa-carbidopa to a client with Parkinson's disease. C. Ondansetron to a client who has nausea from the last 5 minutes. D. Aspirin to a client experiencing an acute myocardial infarction. Write your answer in the comment box. Okay, let's see the correct answer. Correct answer is D. Aspirin to a client experiencing an acute myocardial infarction. Here's the rationale. Option D. Aspirin to a client experiencing an acute myocardial infarction is correct because aspirin is a critical medication for clients experiencing a myocardial infarction, MI, as it helps reduce platelet aggregation and improves blood flow, potentially limiting the extent of heart damage. Option A, metoprolol to a client with essential hypertension, is incorrect because while managing hypertension is important, it is not immediately life-saving in the context of an acute MI. Option B, levodopa-carbidopa to a client with Parkinson's disease, is incorrect because levodopa-carbidopa is important for managing Parkinson's disease, but does not take priority over treating an acute MI. Option C, ondansetron to a client who has nausea from the last 5 minutes is incorrect because while managing nausea is important, it is not as urgent as treating an acute MI. Let's continue to the next question. This blood transfusion question has been asked 4 times in the NCLEX exam. A nurse is preparing to administer a blood transfusion to an adult patient. Which cannula size is most appropriate for this procedure? A. 14 gauge. B. 18 gauge. C. 22 gauge. D. 24 gauge. Make sure to write your answer in the comments. Okay, let's see the correct answer. Correct answer is B. 18 gauge. Here's the rationale. Option B, 18 gauge, is correct because an 18 gauge cannula is recommended for blood transfusions as it allows for rapid infusion and minimizes the risk of hemolysis. Option A, 14 gauge, is incorrect because a 14 gauge cannula, though larger, is often too large and may cause discomfort or damage to the vein. Option C, 22 gauge, is incorrect because a 22 gauge cannula is too small for blood transfusions, which could result in slower infusion rates and increased risk of hemolysis. Option D, 24 gauge, is incorrect Because a 24-gauge cannula is typically used for pediatric patients or for very fragile veins and is not suitable for blood transfusions in adults. Let's move to the next question. This urinary bladder urgency question has been asked 5 times in the NCLEX exam. Which anticholinergic medication is appropriate for treating urinary bladder urgency and incontinence? A. Ipratropium. B. Oxybutynin. C. Tolterodine. D. Scopolamine. Think about your answer and write it down. Here's the correct answer. Correct answer is B. Oxybutynin. Here's why this answer is correct. Option B, oxybutynin, is correct because oxybutynin is an anticholinergic medication specifically used to treat urinary urgency and incontinence by relaxing the bladder muscles, reducing spasms, and increasing bladder capacity. Option A, ipratropium, is incorrect because ipratropium is used for respiratory conditions like asthma and COPD, not for urinary issues. Option C, tolterodine, is incorrect because tolterodine is another anticholinergic medication used for urinary bladder urgency and incontinence, but is not as commonly used as oxybutynin. Option D, scopolamine, is incorrect because scopolamine is used to treat motion sickness and irritable bowel syndrome, not urinary incontinence. Let's continue to the next question. This rhabdomyolysis diagnosis question has been asked 4 times in the NCLEX exam. A client in the emergency department is suspected of having rhabdomyolysis. What finding supports this diagnosis? A. Clear urine output. B. Hypertension and bradycardia. C. Elevated creatinine kinase, CK, levels. D. Decreased serum potassium levels. Write your answer in the comment box. Now let's see the correct answer. Correct answer is C. Elevated creatinine kinase, CK levels. Here's the rationale. Option C, elevated creatinine kinase, CK levels, is correct because elevated CK levels indicate muscle breakdown, a hallmark of rhabdomyolysis. CK is released into the bloodstream when muscle tissue is damaged, leading to high serum levels. Option A, clear urine output, is incorrect because rhabdomyolysis often results in dark, tea-colored urine due to myoglobin release from damaged muscles, not clear urine output. Option B, hypertension and bradycardia, is incorrect because rhabdomyolysis is more often associated with hypotension and tachycardia due to muscle breakdown and fluid shifts. Option D, decreased serum potassium levels, is incorrect because rhabdomyolysis typically causes hyperkalemia due to the release of potassium from damaged muscle cells into the bloodstream. Let's move to the next question. This mechanical ventilation question has been asked 5 times in the NCLEX exam. What medication should the nurse anticipate for a client on mechanical ventilation to prevent a common complication? A. Pantoprazole. B. Hydroxyzine. C. Rivastigmine. D. Verapamil. Don't forget to write your answer in the comments. Let's see the correct answer. Correct answer is A. Pantoprazole. Here's the rationale. Option A, pantoprazole, is correct because pantoprazole, a proton pump inhibitor, is used to prevent stress ulcers, which are common in clients on mechanical ventilation due to increased gastric acid secretion and stress response. Option B, hydroxyzine, is incorrect because hydroxyzine is an antihistamine used for allergies and anxiety, not relevant to preventing stress ulcers in ventilated patients. Option C, rivastigmine, is incorrect because rivastigmine is used for dementia and has no role in managing complications from mechanical ventilation. Option D, verapamil, is incorrect because verapamil is a calcium channel blocker used for hypertension and migraines, not for preventing stress ulcers. Let's move to the next question. This Hirschsprung's disease treatment question has been asked 5 times in the NCLEX exam. During a teaching session about Hirschsprung's disease, what treatment should the nurse highlight as primary? A. Surgical repair, such as a colectomy. B. Gluten-free diet. C. Fecal microbiota transplant. D. Lifelong pancreatic enzyme supplementation. Write your answer down before checking. Let's see the correct answer. Correct answer is A. Surgical repair, such as a colectomy. Here's the rationale. Option A, surgical repair, such as a colectomy, is correct because the primary treatment for Hirschsprung's disease is surgical removal of the affected bowel segment, often involving a colectomy or pull-through procedure to bypass or remove the aganglionic section of the colon. Option B, gluten-free diet, is incorrect because a gluten-free diet is necessary for managing celiac disease, not Hirschsprung's disease. Option C, fecal microbiota transplant, is incorrect because fecal microbiota transplant is used for recurrent C. difficile infections, not Hirschsprung's disease. Option D, lifelong pancreatic enzyme supplementation, is incorrect because pancreatic enzyme supplementation is a treatment for cystic fibrosis, not Hirschsprung's disease. Let's move to the next question. This fetal development question has been asked 6 times in the NCLEX exam. A client at 20 weeks gestation needs education about fetal development. Which statement indicates accurate understanding? A. My baby is about 7 inches long. B. My baby can open his eyes. C. My baby has fully grown fingernails. D. My baby can breathe now. Don't forget to write your answer in the comments. Okay, let's see the correct answer. Correct answer is A. My baby is about 7 inches long. Here's the rationale. Option A, my baby is about 7 inches long, is correct because by 20 weeks, the fetus is approximately 7 inches long, reflecting accurate fetal growth understanding. Option B, my baby can open his eyes, is incorrect because fetal eyes open at around 28 weeks gestation. Option C, my baby has fully grown fingernails, is incorrect because fingernails begin to grow early but are not fully developed until closer to 38 weeks gestation. Option D, my baby can breathe now, is incorrect because fetal lungs do not begin the movements of respiration until around 24 weeks gestation. Let's move to the next question. This post-transsphenoidal hypophysectomy medication question has been asked 6 times in the NCLEX exam in the last 5 years. A nurse is caring for a patient post-transsphenoidal hypophysectomy. Which medication should the nurse ensure is prescribed to prevent complications? A. Methimazole. B. Methylphenidate. C. Ondansetron. D. Omeprazole. Think about your answer and write it down. Here's the correct answer. Correct answer is C. Ondansetron. Here's the rationale. Option C, ondansetron, is correct because ondansetron is an antiemetic used to prevent nausea and vomiting, which is crucial after a transsphenoidal hypophysectomy. Vomiting can increase intracranial pressure and compromise the integrity of the surgical site. Option A, methimazole, is incorrect because methimazole is used to treat hyperthyroidism and is not relevant in the context of hypophysectomy. Option B, methylphenidate, is incorrect because methylphenidate is a stimulant used to treat ADHD and narcolepsy, which is not pertinent to the care requirements following hypophysectomy. Option D, omeprazole, is incorrect because omeprazole is a proton pump inhibitor for treating peptic ulcers and gastroesophageal reflux disease, GERD, which are unrelated to the postoperative needs of a hypophysectomy patient. Let's move to the last question of this test video. This dopamine infusion calculation question has been asked 9 times in the NCLEX exam in the last 5 years. A patient who weighs 85 kilograms needs dopamine at 2 micrograms per kilogram per minute. The dopamine available is 800 milligrams in 500 milliliters of D5W, You need to figure out the infusion rate in milliliters per hour. A, 8 milliliters per hour. B, 7 milliliters per hour. C, 6 milliliters per hour. D, 5 milliliters per hour. Write your answer in the comment box. Okay, let's see the correct answer. Correct answer is C, 6 milliliters per hour. Let's understand why. To determine the correct infusion rate, let's start by converting the patient's weight, which is 85 kilograms. The prescribed dosage is 2 micrograms per kilogram per minute. So for this patient, it would be 170 micrograms per minute, since 85 kilograms times 2 micrograms per kilogram per minute equals 170 micrograms per minute. Next, we convert this to an hourly rate by multiplying by 60 minutes, resulting in 10,200 micrograms per hour. Converting micrograms to milligrams, we get 10.2 milligrams per hour, since 10,200 micrograms equals 10.2 milligrams. The concentration of the solution provided is 800 milligrams in 500 milliliters, which breaks down to 1.6 milligrams per milliliter. To find the infusion rate, we divide the hourly dosage by the concentration, so 10.2 milligrams per hour divided by 1.6 milligrams per milliliter equals 6.375 milliliters per hour. When we round this to the nearest whole number, we get 6 milliliters per hour. Therefore, option C, 6 milliliters per hour, is correct. The other options are incorrect because they do not align with the correct calculation and dosage requirements. Option A, 8 milliliters per hour, is too high. Option B, 7 milliliters per hour, is close but not accurate. And option D, 5 milliliters per hour, is too low. Thank you for watching and sticking with us until the end of these 150 NCLEX questions. We truly appreciate your dedication. Make sure to check our community post, where we will announce the winner. If you've completed all 150 questions, drop us a message on our WhatsApp number or send us an email to let us know. Don't forget to watch the next episode of this series, which will be released soon. Thank you, and see you next time.